Facebook. When do we actually we're not live right now. You haven't started, right?
I'm setting it up right now.
Oh, well, why don't we wait to see when we get a quorum?
Oh, okay.
Yeah, because then we have a lot of dead time. Padmore, welcome. Pauline, welcome.
Hello.
Hi, Steve. Hi, everyone.
Thanks, Paula.
Yeah.
You're welcome.
You set up everything so well every single month. It's amazing.
Padmore, I'm going to read off the numbers from the DOH website that I took down a little while ago. They're a little bit different than the numbers you had this afternoon. So maybe your numbers could have been a day or two old. Is that possible?
Well, the numbers I do is right from the website.
Yeah, but when did you take them off the website? What time did you take them off today?
Yeah, I just literally just go to the website.
Oh, because the numbers I have is slightly different from what you had.
Okay.
Like the percentages of people vaccinated.
All right. So not sure what that was. I'll take a look right now. Obviously, sometimes the numbers may be updated.
Yeah. Yeah, but Pauline, how often are they updated? More than once a day?
I don't believe so. I think they should be updated once a day, and it should say on the website when it's updated. So typically it's either in the morning or sometime in the afternoon, like around 1:30. I can check on the website now.
Yeah,
I'm on the site now, and it says was updated 9:30 this morning at 9:30. Well, actually, I just updated 9:30 a.m. today. Yes.
Oh, really? Oh.
Mm-hmm.
All right.
So hi.
And these
hi,
are
everybody.
Numbers. Sorry. Hello. These are the vaccination.
Hi, Tanya.
Hi, everybody.
Hi there.
Hi.
Hi, Sally.
Hi. So were you on 7 a.m. duty today at a COVID site?
No.
Okay.
I had a friend last night at dinner who had to leave so she could make sure she didn't miss her 7 a.m. call.
Where is that background noise coming from?
Some radio going on somewhere. Thank you.
Are you in Alaska, OC? You're muted. You're muted.
Sorry, I said I wish. My plan is to get to the North Pole at some point, but I don't know that it's going to happen.
Yeah. That would be nice.
I want to drive all the way to Prudhoe Bay. And my husband is not crazy about that, so.
I figure you should want to visit Sicily, Alaska.
Why do I want to visit that?
Because that was, I guess, the make-believe setting for the TV series, the Northern Exposure, which was a really quirky, fun series that ran. I don't know, when did it run? In the 90s?
Early 90s.
Oh. It's all about a Dr. Fleischman from New York City who, I guess, gets one of these scholarships and then has to do community service, and they send him from Manhattan all the way out to some little dinky town in Alaska, and he of course experiences a culture shock, among other things. But it was a great show. I loved it.
Okay, I'll skip that. I just want to get to Prudhoe Bay.
Okay. Yes, a big mistake on your part.
Or not.
Pauline, where's the little one?
He's playing with an extremely loud remote control car, so I banished him to the living room. Always banishing him off to some other room when I'm doing my meeting. Let me see if he'll say hi since we haven't started yet.
Yeah, okay, that would be nice.
Steve, where are you? What's your background? What's that background of?
Oh, what's wrong with you, Tanya? That's the high bridge.
He's in the Bronx. You're in the boogie down.
Yeah,
I'm in the
it's-
boogie down.
Wait, but it's Highbridge from the Bronx and
Yes,
not from
looking at
Manhattan.
Manhattan.
Oh, who's that big kid now in the picture?
Oh, new
Wow,
haircut.
wow, that kid looks great.
An unpaid intern.
Yeah, God.
Yes, creates more work than actual.
Hi,
Hello.
Oh,
are you having fun with the remote control?
It's appreciated.
How you doing with that remote control?
Do you like your remote control car? Yeah.
Yeah?
Okay.
Probably knows more about vaccine sites than we do, right?
Yeah, gosh. You know, if you press really hard on the remote control, your mother has to jump up and down.
Oh, he knows. He knows. Always making me do things. The moment I start a meeting, that's when he needs a snack, when he
Right.
needs his water, when he's
Oh.
missing something and needs to find it right away. It's always when a meeting starts.
Oh, that sounds just like me. All right, so we have Tanya, Daryl, Sally, OC. Anybody else? Come on, I need one more for a quorum.
Is anyone calling out?
Not that I know of.
Oh, okay.
All right, we'll give it a few more minutes.
Maybe they forgot the new time, 6:30.
Yeah, maybe they were looking at our website that says 7 o'clock.
I doubt that.
Yeah, I doubt it too.
The email says so.
I had actually assumed it was 7 o'clock and then saw it pop up on my phone and said, oh, I better go now.
You're very angelic, Fern.
Yeah, I have a light in my room and in the daytime, it's the window. So it doesn't matter
Oh,
what meeting I have. It always sort of looks that way.
Hi, Fern.
How are you, Natalie?
Good.
By the way, Natalie, they have some really cool boxes on the tree guards outside of your uptown office. I was tempted to plant something in them the other day. I was on my way home from the Jackie Robinson Community Garden. And I thought, I can just stick some seeds in here and maybe by the time they get back, they'll be growing. But I restrained myself.
Feel free to do whatever you want, Sally.
Thanks. I'll do it next time.
Oh, God. Oh, God.
what happened to your picture? You disappeared, Steve.
Yeah, I'm looking at the participants.
Ah,
crossing the bridge.
Yeah.
bridge I didn't recognize. Embarrassing. That's really embarrassing.
You're still in the Bronx, Steve.
You're not
Yeah.
on Parks, are you?
No.
You think I'm not going to want to feature the water tower, the beautiful, iconic Highbridge water tower?
That's true, but that's actually, but you're sitting in the Bronx.
No, I'm sitting in the middle of the river.
Okay,
Well, I did grow up in the Bronx,
okay. Where exactly?
way out east, and what the hell was the name? I think the neighborhood was called Williamsbridge, or no, it wasn't. What the hell was it? It was around Boston Post Road.
Okay,
Not that far from Co-op City. In fact, we ended up moving into Co-op City as one of the
Oh.
original residents.
wow. Did you like it there?
No. No,
That was a
moved.
very definite no.
I moved out as quickly as I could. It was so damn far away, and I would find myself running across the New England Thruway, darting trucks at 2 a.m. So I decided it was too risky.
Yeah,
I
this
lived,
whole,
I lived there for a little while too.
Yeah. Well, you probably didn't do what I did in running through. There was a footbridge further down the thruway, but I didn't walk. I didn't want to walk all the way over to the footbridge, so I would run across the highway as cars and trucks were speeding by.
Steve, don't tell us that.
You must have been very young.
I was in my early 20s.
We're
Not
gonna
sound
need a
like a good
disclaimer.
idea.
You have to put a disclaimer on the Facebook. Do not attempt what Steve Simon was talking about.
Oh, we're not live. Please.
Yes,
we're not
we
li-
are. It's
we
it
are,
says
and,
live on
it's being
Facebook.
recorded.
What's that?
It's already being recorded. Like it's part of the recording, part of the meeting.
Oh my
Yeah.
God.
Our small talk is always part of the recording.
Oh gosh. Okay.
Well, that was your experience, and
Yeah,
that's
well,
fine.
It was true. It's true. All right. I think in that case, we better get started. Hopefully we'll pick up some more people very shortly. All right. So let me give my regular report based on the health department statistics on the COVID-19 impacts on our 4 zip codes. This is for the week ending March the 1st, which should have been Monday. And the positivity rate in zip code 34 was at 7.84%, slightly above the weekly citywide average, which was 7.46%. So there were 113 new cases in the week ending Monday in zip code 34. It ranked number 39 in the 177 zip codes in New York City. In zip code 40, ranking at number 52, the positivity rate was 7.33%, 114 new cases. Zip code 32 was ranked at 103, 103rd ranking at 5.53%, 151 new cases. Zip code 33 was at the lowest positivity rate, 4.75%, ranked at 119 with 107 new cases. Now, the total cases since the beginning of the pandemic for zip code 34, 2,967 and 92 deaths. Zip code 40, 3,546 cases and 144 deaths. Zip code 32, 4,509 cases, 208 deaths. Zip code 33, 4,056 cases and 147 deaths. So since the beginning of this pandemic, we've had 5,078 cases of COVID-19 in our 4 zip codes and 591 deaths. So the positivity rate is down in all 4 zip codes since we met a month ago on February the 4th. Fewer cases last week in the week ending March 1st compared to the same week the month before. And but we've in the intervening month, we've now had 2,000 more cases and 50 more deaths. And in terms of the vaccination rate for the adults in zip code 34, 8% have now been fully vaccinated, 7% partially vaccinated. In zip code 40, 10% fully vaccinated and 8% partially vaccinated. In zip code 33, 10% fully vaccinated, 8% partially vaccinated. And in zip code 32, 12% fully vaccinated, 8% partially vaccinated. I got to say at the outset that once again, I'm very disappointed that The hospital has declined to answer the questions that I have posed to them and provide me with information and statistics on the numbers of our local residents who have been vaccinated at the Armory and the number of COVID-19 patients overall that have been treated at the three New York Presbyterian facilities in our district. We will have a representative from the hospital on the agenda later. She's actually speaking to the Housing and Human Services Committee before she comes to us. But she apparently doesn't have all that much information to provide to us. She's going to talk about the bilingual call line, which is a good new feature. And but I still believe that we are owed basic information about COVID-19, how they've been adapting to it and how they've been handling the number of patients in these three facilities. And I certainly believe that it would be helpful to us to know how many people in our district are being vaccinated and the extent to which they are successfully doing outreach into the 4 zip codes in our district.
Don't forget my questions in all that.
Well, yeah, you're free to ask those questions, but I couldn't even get basic information out of them, so I wasn't too optimistic in getting answers to your 2 questions either.
I'm not optimistic, but I'm not going to just sit quiet.
Okay. No, all right. Well, I'm not going to tell you no, you can't ask your questions, but it's unbelievable to me that we can't get basic information from the hospital. And if people on the committee want to join me and back me up on that, I would certainly appreciate it. All right. So the other big news for the last week, very big news in terms of Washington Heights. And Tanya pointed it out. She sent us all an email a few days ago. There's a story that ran in the New York Times last week based on research done by Dr. David Ho at the Columbia University Medical Center. And you'll remember that Dr. Ho spoke to the general board a couple of months ago. And his unit analyzed 1,142 samples from patients at the medical center. So here, in fact, for the first time, we know that there were at least 1,142 COVID-19 patients at the medical center, which we haven't even known ever up to now. For the last year, have had no numbers whatsoever. Now, at least we know, since he checked 1,142 samples, there must have been at least that number of COVID-19 patients at the medical center. But more importantly right now is that he found that 12% of those people, 137 presumably, have been infected with a variant that contains a mutation which they refer to as E484K. This variant evidently transmits maybe 9% faster than the regular COVID-19 virus. But it's, and hopefully Padmore will speak to this, but it is not necessarily known to maybe cause greater damage or a greater number of deaths. But it would still be, I think, enlightening to us to know how the hospital has been able to treat these patients and the extent to which they've been able to recover, which is apparently information which we will not be getting from the hospital. So Padmore, let me turn it over to you, and hope, as we discussed earlier, you'll go into some greater detail about the significance of this finding of the variant here in Washington Heights. And actually, let me just mention one other thing. What really brought this also to the fore was the fact that Dr. Fauci, whom we all respect and for all of the work he's done over the last year, Dr. Fauci in a White House briefing on Monday specifically mentioned the existence of this variant and the fact that it presumably began here in Washington Heights. So which is, I think, was pretty startling to many of us. So Padmore, let me turn it over to you. Padmore is the manager for the Harlem Neighborhood Health Action Center and is associated with the New York City Test and Trace Corps, New York City Health and Hospitals.
Well, with the With the Department of Health, Steve.
Oh, I'm sorry.
Yes.
Department of Health. I
That's
keep
okay.
getting that wrong. Okay.
That's all right. So as indicated, there has been a new variant that has been identified. Don't want to refer to it as the New York or the Washington variant, but as B1526. Was something that unfortunately most recently was identified and hasn't been seen to have come from that general area. We do not know. There's not much. We have to be honest with you, Steve. There's not much that we do have in reference to it. Generally that this is something that occurs often. Viruses mutate, right? So I don't necessarily want to think that whether there's something that is being done in the general area that has caused or led to this. This is completely out of anyone's ability to control. Viruses mutate. This is something that's common. And in this case, this is what we have seen. As to whether or not this particular variant is more deadly, is more easily to be spread, is more easily catchable, I don't think we have enough information at this point in time to be able to make any of those claims. But I do want to say that the fact that more and more of us that are out there that are either not wearing any type of protection or not being able to get vaccinated kind of allows a larger and deeper.
If you're about to go to my room, can you put the thing on the other TV so I can watch it over there?
It allows to have a larger and deeper pool that allows more variants to occur. So it's really up to us to ensure that we're continuing to practice the core 4 and we can and as much as possible to ensure as many people have been able to receive the vaccination. But in terms of numbers, in terms of virulency, in terms of ability to spread, we do not quite know that much about it. What I can say is that from different studies that have been shown, it has demonstrated that all the vaccines, the Pfizer, the Moderna, and the Johnson & Johnson have been pretty successful in addressing this particular, the various variants that we have seen. From what it has been indicated, they are capable of preventing the disease from being spread, as well as getting extremely worse once whatever variant that you may technically have that may be in the community that you are at. So the vaccines that we have right now have demonstrated some efficacy in terms of addressing these variants. So that is the good news. The bad news is that, of course, there are different variants that are coming up, but the way for us to really protect ourselves against these new variants is to continue practicing the core 4 and to continue an accelerated vaccination effort. I'll stop there if there are any questions, any more specific questions. And Pauline, any information you may have you want to add, please, as well.
I had a question. This is Sally.
Yeah, Sally, 1 second.
Okay.
Pauline, did you have anything you wanted to add?
No, I think Padmore covered it really well. Thank you.
Okay. Okay, Sally, go ahead.
Yeah, one of the things that's happened, I guess, as a result of this news coming out is that a group of doctors from, I think, Somos have demanded that we have a full-blown vaccination effort in Washington Heights, Inwood. Right now, we have the Armory, but they're only vaccinating over 65s and those with underlying conditions. So we have nothing for essential workers in our neighborhood. And so I guess my question is, are there any plans given what's going on in this variant coming out of Washington Heights, Inwood, to consider sort of a fully loaded vaccination effort in Northern Manhattan?
So I can speak that in the sense that one of the things that we have been doing, I would say in general, there is a plan to try and get as many people vaccinated as quickly as possible. Very specific to Washington Heights, it has been As you know, there's still some amount of supply challenges between the other drugs, Pfizer and Moderna. Johnson and Johnson have just started coming out, so it's not making that much of an impact in the supply at this point in time. But we are hoping to be able to have, like, in the next few days, within the next week, a steady supply that may be coming in to really augment the amount of that we have. What we have been doing is working very closely with a variety of community-based organizations to ensure that as many individuals that are having a lot of challenges in terms of being able to get access to the vaccine, that they're able to do that. They have also, we have worked with Black Health, Harlem Community Justice Center, as well as the NAACP, and to ensure that they're reaching out to a variety of individuals, and very, as much as possible, be able to get them appointments at some of the locally based vaccine sites, including A. Philip Randolph on 135th. We have, and also on lower, a little bit further down on the east side, which is at our Action Center on 115th and Lexington. We have also been working in getting some vaccinations over at the Ford Foundation, which is on 42nd Street. So this is a continued effort. I understand that it's a little bit far away from Washington Heights, and it's a little bit more difficult to travel. And so there are other programs you're working with. One of the things that we have done most recently, just last week, over, I think, Thursday, Friday, Saturday, we had a pop-up vaccine site at Dyckman. It was pretty successful. A significant amount of individuals, Dyckman houses on Nagel Avenue, a significant amount of individuals were part of that process. So we are going to be continuing to kind of do these pop-ups to continue the work of community-based organizations. We also know that the Armory and New York Presbyterian is doing a pretty significant dent. But yeah, those are some of the programs that we're looking to be able to ensure that as many people as quickly as possible get vaccinated.
I guess just to follow up really quickly,
Yeah,
my
go ahead.
concern, as it's been throughout the pandemic, is that we have the highest concentration of essential workers, and yet there's no place for them to get vaccinated currently within Washington Heights and Inwood. So I worry when I see spreads and variants and that kind of stuff that we're just ignoring a huge collection of individuals that we know are disproportionately represented in our community board district.
So,
Yeah, and if I could just back up what Sally has said, because she's raised a very good point. And as good as the Armory is, it's not good enough. And I've made this point, Padmore, that on some of our other calls, where we really need to have another solid location further north. And I recommended we use George Washington High School, or maybe IS 218. I was hoping we could have a site up in zip code 40 because of the elevated positivity rates up in that area, and maybe even at this point further north, because zip code 34 is now running ahead of zip code 40. But we need to make it, as you know, we need to make it as convenient as possible for people, and people are finding their way to the Armory, but not everybody can do so. And until we hear that they're really making successful community outreach efforts, it seems to be just not sufficient to reach everybody who needs to be reached. I mean, we're barely cracking 10% in our zip codes. I mean, we got a hell of a lot more people to reach, and in two of our zip codes, we're in zip code 34, we're under 10%. We need to find another location, and George Washington High School, I don't think there are any high school classes going on right now.
Steve, I'm sorry to interrupt. There are hands up.
Oh, all right. Well, let me give Padmore a chance to respond, and then we'll call on the hands. Are you?
Yeah, so there's a couple of things that we're looking to be able to do. One of the things is to be able to ensure part of the training to make assistance for anyone who can go through the process of learning. And this is part of our train the trainer program, where we are teaching individuals how to go through the process and help individuals get appointments. We also have a program where individuals may be able to sign up folks on the ground. So that's something that's coming out as well. We have an app that is going to be able to be utilized. Now, in terms of the location, I completely hear what you're saying, Steve. To have another location, obviously that's something we would love to be able to do, but that's in terms of the supply and the staffing. That's some of the challenges. So the agency is looking at that at the moment. We are there, obviously. The Wadley site, which is one of the key part site in Manhattan, was closed down because of the opening up of middle school. The site at currently at A. Philip Randolph, which is at 135th, just south of Washington Heights, that may be closed when high school is going to be opening up. So we're in the process of being able to, one, identify other sites, but at the same time being able to see how local primary care providers may be able to be supportive of this effort. With the Johnson & Johnson, it's going to be, some of there's a lot of primary care providers in the Washington Heights area, so being able to get them access to the vaccines, that's something that we hope to be able to do. But in terms of a large scale site, I do not know, maybe Pauline have some information about that. But at this point in time, I do not know of any large scale site that is going to be coming online.
Well, listen, I mean, if every doctor had the vaccine in every pharmacy, that would do the trick too. I mean, if you could walk in and to your doctor or to your drugstore and get the shot, get the vaccine, that would be the best thing, maybe. Pauline, did you have anything to add?
Yeah, I just wanted to add that, your concerns are heard very loud and clear, and we've relayed this information back to the VCC. And I think a lot of it is just the infrastructure that currently exists. And I know you've heard this all before, and it's not satisfying, but this is just the reality that we're dealing with, is that the lack of vaccines, but also just the infrastructure. But we are hoping that with the new Johnson & Johnson vaccine, the fact that it's more stable, it doesn't require this extreme cold temperature or refrigeration. It's a 1-dose vaccine. All of this can help ease locations in which we can have mass vaccinations. And so I think we're looking at, some sites that you have suggested in Washington Heights, including the Isabella Senior Center and some other locations as well. So that's all on our list. We're all very aware about the lack of vaccine sites in Washington Heights. It has been something that we've all been very concerned about since the beginning, but we just want to make sure that it is on our radar. It is something that the VCC is working towards, building out and staffing. So we can definitely share more information as it becomes available.
Okay, and tell us what VCC stands for.
Oh, the Vaccine Command Center.
Oh, okay. All right, very good. Daryl, who do we call on first?
Tanya.
Oh, go ahead, Tanya.
Hi. Thank you, Pat Moore and Pauline. I have two questions actually. One is to what extent do you think the scheduling system is playing in, what role do you think that's playing in the low vaccination rates? I mean, I was lucky. Someone emailed me a mysterious email from NYP and said, email this person and you'll get, to get an appointment to get your vaccination. And I did, and they got back to me within 2 hours. And I had an appointment for last Saturday. I got my first dose, Pfizer, at the Armory. Yeah, and so that worked. But someone just said, you need to email this person at this email address, and so it was like lucky on my part, but I just wonder, because I know that people describe it as like the Hunger Games, trying to get an appointment and then, other things. And so I just want to know, what do you think the extent of that, is playing in this? And in terms of the variant, do you know if travel played a role? You know, I know a lot of people that were traveling over the holidays, going, you know, overseas and traveling other places. What role do you think that might have played? Last question is about the Johnson and Johnson. There have been articles, I think it was in Washington Post, Wall Street Journal, please don't quote me on which one, that talked about the concerns about J&J vaccine being lower quality and going to be offered to poor communities, and they, you know, as an option, and instead of what is considered the better vaccines. And I just want to know if you could speak to that. Sorry if that's a lot, but I just want to get them all out there while I'm talking.
Right. I may ask you for one or two again, Tanya.
Okay.
And so for let's start at the third one in reference to the differences. The Johnson and Johnson.
Yes.
It has been demonstrated to be as effective, very effective, as the Pfizer and Moderna. And I think that's really important that we do not classify it as being technically being going for the lower communities, for you know, communities of color or anything else like that. They are being distributed across the board evenly. You know, right now they are going to be offered at Javits as well as Yankee Stadium, where all different type of people are coming in. So it's not necessarily being sent to very specific neighborhoods or areas. For a lot of the, in terms of efficacy, the mRNA is a different way of how it addresses. The Johnson and Johnson is not an mRNA. It's a DNA based virus, viral vector. So it's a little bit different in terms of the way it works, but but it has shown to 100% in terms of prevention of hospitalizations and deaths for all those that have received it. As in terms of limiting the extent of the disease once you receive the virus, it's maybe a little bit less than the Pfizer and Moderna, but not by much. So it is very, very effective. I think it's also important to know that this is a vaccine that, as Pauline had earlier said, does not require this really cold storage equipment. So it does, because of that, it's a little bit more transportable and can be at shelf life or at normal room temperature at a longer time as opposed to others. So that gives it a little bit of the ability to be transported a little bit easier and for it to be going to a lot of different places where Pfizer and Moderna were not able to. So just because of that, and again, it's a one-shot vaccine. So there are certain benefits to it that attributes it to being utilized in a different way than the Moderna and the Pfizer, but that doesn't mean it's any worse or not as good in any factor, nor being direct to any particular community. I think Dr. Fauci said it, that all of these vaccines have really demonstrated the efficacy level that most scientists will be, jumping over the moon with. So we are very lucky to have 3 very effective vaccines, and in no way is the city going to be directing them to any particular neighborhood or any particular community. So I can say that very, very loudly. Tanya,
Oh, sure. And the other question was about the role that the appointment system, the difficulty of that in terms of the low rates, and then the variant with the travel. Did the travel have something to do with?
Yeah, I mean, right, and then the travel in terms of the variant. Now, well, in reference to the appointments, we definitely think to some extent that has been one of the challenges, in terms of individuals being able to get online, being able to secure appointments. Sometimes the appointments, the slots are open up, and you kind of have to refresh, and there is a digital divide. We don't want to say that's not the instance, but there is a digital divide that has an impact. So that's why, I'm recognizing that, right? And part of the reason why the Department of Health is very open in terms of the zip codes and what some of the challenges in some of these zip codes is, so that we can identify some of the places where we do need to have special intervention. So this comes in the way of some of the CBOs, the partnerships that we have developed with the CBOs. This comes in the way of deployment of staff that are going to be able to write on site, outside in the streets, be able to sign people up, and bypassing some of those appointment challenges, the digital talent challenges. So yes, we recognize that I'm not gonna say it's the only reason, right? But it's definitely one of the challenges that has come up. But yeah, being able to recognize that and be very directed in terms of where intervention needs to be. And in this case, being able to help us individuals, and we're doing it in a variety of ways. One is just simply to, even though someone may be able to get on, they don't quite know exactly all the different steps that they need to do once they're online. And so being able to train individuals to help others to do that, being able to have CBOs to completely bypass that whole appointment system altogether, and then also to have individuals out in the field who are able to sign up folks for them and being able to do that in a much quicker way. So those are some of the ways that we're addressing that, but we're not going to say it has not had an impact. It has. It's not the only thing, but we're definitely looking to address some of those. And then in reference to the travel and variant, that's why I think it's very important that we recognize that, you know, this may have been where this particular variant was first seen or first observed, first identified, first localized, but it's not necessarily germane to Washington Heights, right? We have a lot of individuals that are coming in and out through travel, through friends and family, to people that are, you know, coming across the bridge from New Jersey and to come and eat, to do different things. So there's a lot of opportunities for different folks that are not necessarily native to the Washington Heights area to be there and not necessarily practicing appropriate protective measures that allows some of these variants to occur. So I definitely don't want us to think that this is a Washington Heights variant. Let's identify it as just B1526. That is the official scientific term for it. And hopefully we'll be able to continue to practice, to continue to allow vaccinations to occur, and that it you know, simply disappears together with the other aspects of COVID.
Thank you so much.
Okay, we now have somebody who can speak to us maybe with more.
There's still another question, Steve.
But I know, but I now have Dr. Lantigua calling in, and I'm told I only have him for a little bit of time. So is he calling? Do we have to upgrade him, or can he?
He's already there.
He's already. Rafi, can you hear me?
Yes, I can hear you, Steve.
Okay, well, I can hear you. So Rafi, as I told Sandra earlier, and I guess as you may have heard, you know, there's a lot of concern in the community, obviously, about the fact that this variant was discovered at the medical center by Dr. Ho and Dr. Fauci on Monday at the White House referred to it as being originated here in Washington Heights. So there's a lot of concern about the fact that maybe 137 or more patients at the medical center had this variant. We don't really know how many. It could be more than that at this point. And we don't know what's become of these people, whether they were able to recover. What can you tell us about how this variant has been dealt with at the medical center?
Thank you, Steve, for the invitation. Let's begin by this is not a Washington Heights variant. And let's call it a New York variant, if you want to. And I think that John was making this clear in the beginning. I mean, this is a serendipity findings, no? I mean, that Dr. Hall, who have been working on COVID, I mean, for that 13 months, was really looking for UK, South African, and Brazilian variant. And he found in November, about 10 weeks ago, the first case. I mean, that all we can say, it was first discovered in New York. But we don't know if it was in other places before being in New York. Since they discovered, this variant has been found all the way south to North Carolina, north to Massachusetts.
The same exact variant?
The same exact variants, yes. The same exact variant have been found all the way up to North Carolina. And this was 1 week ago. I mean, again, all we can say that it was first described in Washington Heights, a New York Presbyterian. I mean, we're so lucky that we have scientists there. In the case of David Ho, who you know, I mean, he was looking for, and he was able to see, oh, this is different. Like I mean, said, I mean, it's 474 at mutations, and it's like I said, B.1.526, no? I mean, in cases. I mean, and like you said, I mean, every day is more cases. What we know that in our neighborhood, this variant is doubling every 11 days. I mean, that for the time that he made the discussion on Monday, obviously more cases. And we expect that by the end of this month, this is going to be the most predominant variant in our institution. In the most cases with COVID are going to be seen in the ED and admitted to the hospital, this variant. It may be that it's not only us. I mean, it's true. If you see the numbers from the city, I know you have seen the numbers from the city in the last 7 days, 134 in our zip code has a positivity rate of 8.3.
Yeah, well, right now it's at 7.84.
Okay, well,
It went down slightly.
It was like that, yeah, that's it, but it changed from that day to day, no?
Yeah.
There, we know that the numbers, I mean, in the country has plateaued. We know that more or less they stay the same. I mean, in our institution, they stay the same. I mean, people have been asking the classification of these cases. I mean, remember, when he started looking into this variant, all he was looking is, it was a serum. I mean, plasma, blood of these cases. He didn't know any of the clinical aspect of these cases. Now that there are sufficient cases, the clinical infectious disease department at Columbia start going back and reviewing those cases. Again, remember, if we are going to be doing research now in individuals that we're looking at their medical records, we had to get permission from the IRB. And again, it's nothing like we can go in there and say, oh, look, this person had this, let me go, let me look it up, and let's find out. We can't, I mean, that's not the way. It's not ethical, I mean, to do this. I mean, that they just acquire IRB permissions, and that they're going to try to put this data together, like you said. I mean, how many cases have been seen in the emergency department and they have been sent home? How many cases have been in the hospital? It's any case that had the vaccine and was admitted to the hospital, or any cases that had the vaccines and they were admitted. We know of one case, and we don't want to call that case zero. We know a person that's infected with HIV, and that person has been infected with COVID, the natural COVID, since August. That person is immunosuppressed and has not been able to clear the original COVID. And that person also is positive now for the new variant. And that person having two viruses at the same time, very rare. It's only one case in that sense. I mean, again, every day, tomorrow, the vaccine committee, which I am a member of, is meeting. We hope to have more data, but it's going to be a slowly process. I mean, as we get to see more cases, and as the city also put together more cases, because then the city is collecting also data from other neighborhoods where they are seeing this variant, especially South Bronx, Queens, and Brooklyn.
So you're able to go, so when Dr. Ho says that he's looked at 1,100 samples, those are not necessarily patients who have been in the hospital just within a tight timeline. He can go back weeks or more to people who may have already been discharged to see whether or not they had this variant?
Correct. And he can also go and get blood for people who have been in the emergency department.
But Rafi, this is you still have the blood on file for these patients who are no longer in the hospital? Is that how it works?
No, usually blood is discarded in this, but PCR, I mean, you have PCR, I mean, it gets sent to him, I mean, from people having in the ED, but they went home. Yeah, and because this patient are follow up as an outpatient, then he can see that that patient came to the hospital, what happened to that person? That person didn't have to be admitted. I mean, he's able to know that, or a person that comes to the clinic, or a person that's going to have, let's say, a colonoscopy, and or he's going to have surgery, and they get PCR, and the PCR is positive, and that person went home and had no symptoms. I mean, that we are now able to go back and trace all those clinical cases that are positive and see how they behave to have an idea. I mean, we know that's very contagious, but we cannot say that it's different than the original COVID virus to this point. And he knows, and he told you, I think he has said very clearly, because Dr. Ho works his antibodies, he said very clearly, and we have to be clear not to be confused. He said very clearly, we do have 4 monoclonal antibodies. And this is a medication that's been given to people in the emergency department when they come with moderate COVID. It's giving over 50 minutes to half an hour. They respond very well. And an hour later, they are sent home and they don't have to be admitted. What Dr. Ho discovered in the lab is that this variant doesn't work against 3 of the monoclonal antibodies that are available. Only one of them, the Regeneron, appears to work. That now we know, and we are alerting the emergency department to be clear that if you are dealing with this variant, they could not get the Lilly or others at the monoclonal antibodies. He also knows that when he exposed this variant to serum antibodies, remember that we have been recovering serum from patients that have been infected with COVID and giving them to people who are infected. It's been done less and less and less these days because it doesn't appear to work very well. But he also knows that people that have had these antibodies, when he put the variant in front of them, do not work very well either. I mean that we know, he knows now there are some decrease with the new variant in the treatment. We're not talking about other type of treatment. Remember, we have dexamethasone to treat patients that the only medication that's known to work and decrease mortality has been used inside the ICU mainly to people who have severe COVID. I mean, it hasn't been proven against dexamethasone to say that, okay? I mean, in that case, we know. He also knows in vitro, this is not in vivo data, in vitro, this is in the lab, there appeared to be some decrease in effectivity of the 2 vaccines that we had at that point available. It was Moderna and Pfizer. It doesn't mean there's 0, and we have to be very clear to that sense. I mean, again, the vaccines are effective 95% for Pfizer, 94.5% for Moderna. It may be that it decreased to 70%. That's still good, because these 2 vaccines are so good. We were talking in the beginning that any vaccine that was over 60%, like the influenza vaccine, it was a very good vaccine. They were able to discover the 2 outstanding vaccines. I mean, 95%, 94.5%. Again, I mean, and then if you talk to all epidemiologists, to all virologists, to all infectious disease people, they say, look, the only way to avoid a virus to replicate and to do mutation inside a body is through vaccinations. And that's what they're saying. They're encouraging people, let's go and get vaccinated. And I feel that the point in here is education, trying to get people into the armory. It's been sure, I mean, that those who are eligible get their vaccines. I mean, that they get to know that we have more, now we have JJ, Johnson & Johnson available, that's now in this city, that they're able to go to primary care physicians, that they're able to go to pharmacy, that we could open more sites besides the armory. We just came from the city. They're going to be going to the senior centers. They're going to be going to NICHA more frequent, to the faith organizations. I mean, what we have to press now, because of this variant, let's try to get, especially in community colors, Harlem, Washington Heights, South Bronx, the most that we can to accelerate the vaccine process. If we have to begin with 25 to 40% natural immunity in some of our neighborhood, and the lowest 25, the highest around 47, and we can get 20, 25% more through vaccines, and we're able to get to 70, 75, we're going to be able to cross this bridge.
But you agree, don't you, that we need more vaccination sites besides the Armory in Washington Heights and Inwood. We can't depend solely on the Armory.
I agree 100% from the beginning. I mean, 100%. It's
Right.
not a friendly access place. We know that. To tell people from Harlem to come to Washington Heights or from Inwood to come to the Armory. No. I mean, I feel that we need more places. We need places also open more clearly. I mean, we need places to be open more clearly to those who are not NYP patients. I mean, we are calling all our patients.
Right, right.
What about if you are not a patient of NYP?
Steve, sorry to interrupt. I had a question just about what you were talking about, which was my question from before as well, to whoever can answer it. I had a conversation earlier this morning with someone at Health and Hospitals, and they were talking about more vaccination sites and some of the requirements for that. And part of that was they needed 5,000 square feet of space, and they needed to use that space for 4 to 6 months. That seems like a lot, and that there won't be a lot in our community or other communities. Can you speak to that, and if that could change? I don't know if that's you or Padmore or whoever.
We just heard from a senior official from the mayor office, who is in charge of vaccine, tell us that they're going to start doing vaccinations to seniors at home.
Right.
I mean, at home. I mean, that then we're not talking about 5,000 square feet. We are pushing to have the pharmacy to be able to administer this. We feel that we should be using mobile van also to be able. We have the dental van at Columbia, he's sitting there. You could easily place that in front of a senior center and be able to, what we have to do, and you have to do as community leaders, is advocate to have more site, to have regular pharmacy. And this is the city and the governor. Happen to be some of the new site only been told that they can only vaccinate people who are over 65 years old and so nobody else. I mean, that if you have a medical conditions over 18 years old, the new site will not be allowed to administer the vaccine. We want to be sure that yes, that taxi drivers, the grocery workers, the restaurant workers, the home care workers, all of these should be vaccinated, and we don't have site in our area. It's not a site in Washington Heights. They have to go to Yankee Stadium if you are a taxi driver.
Right.
If you are a grocery worker, you have a grocery store worker, you have to go to Yankee Stadium. I mean, it's not a site in Northern Manhattan. I mean, that's not fair. We had 10,000 drivers, 25 taxi drivers. I mean, our bodegueros. I mean, where they had to leave their bodegas and go to Yankee Stadium from the Inwood. I mean, again, I think that's at the CB12, and you are leaders, but you have to start pressing the city and the governor, Gozado, and others, and say, look, we need, especially in view of this new variant, we need really to open this site to more places in our neighborhood.
All right, thank you. Are you going to be able
Well,
to
and
stick
I will just follow up and say we also talked about sites. There are a number of organizations that have been closed during this pandemic, and there's no incentive that the government's willing to give to open them up to give out the vaccines at this time. They want them to do it for free. They might pay for maintenance, but that's it.
What did you say earlier? That you were told that you need 5,000 square feet? Is that correct?
5,000 square feet, and they need to use the space for 4 to 6 months.
4 to 6 months, yeah.
Yeah. There are other hands in OC and then Sally.
OC hasn't spoken yet. Go ahead, OC.
Okay, thank you, Steve.
Well, one second. Rafi, could you stick around?
Yes, I can.
All right, thank you. And I'm probably going to want you to come back next month too.
That's okay.
Okay. All right, OC, go ahead.
Yeah, so I guess, Rafi, you were talking about, more vaccinations, but let's not forget that when the vaccine became available on December 14th, the hospital was mainly vaccinating people out of the district from Long Island, from Connecticut, from Westchester. So I agree that, I feel like it's I don't want to say it's too late, but it's kind of, we are behind because of that. My question, I don't know that you're the right person to answer, is during the time that Colombia was vaccinating people out of the district, I wonder how many.
Not Colombia, not
It was
Colombia.
the New York Presbyterian, but we're partners. We're partners.
Okay, fine.
Whoever that can answer that question, I'm
Yes.
not sure.
Okay.
So I would like to know how many people outside of Washington Heights, Inwood, got vaccinated prior to the discovery that Columbia is vaccinating residents from Long Island, Westchester, and other, and the number of Washington Heights, Inwood residents eligible for vaccination that die because the available appointments were not giving to them, meaning the available appointment giving to Long Island, Connecticut, Westchester. So I know that you guys have the number because it's all about data. You know, this is how you guys and the Department of Health figure out how many people vaccinated from particular zip code, what's the percentage of people that are sick or people that die from particular zip code. So the hospital has those numbers. I would like to hear those numbers, and I will not take an answer that you don't have those numbers because I know you do.
Well,
I'll respond.
Sandra, we don't have, I mean, I'm a member of the vaccine committee. I don't have those numbers. I don't know those numbers. But I know because every person who get vaccinated with the address had to be sent to the governor office and to the city. I mean, they know the city and the governor has those numbers. I mean, I'm sure that it should be public data. You should request the data.
I see what I would say is, as Dr. Antigua said, because we're CUIMC, not the hospital has those numbers. It would have to be a question that needs to be answered by them. There is a reporting mechanism between hospitals and the state. And again, that's a question that needs to be posed to the hospital. We're not at liberty because we don't have access to that data.
So who is
from the Columbia
person for that?
University side.
So we're here sitting at the Health and Environment Committee. You guys representing the institution, the Columbia Presbyterian?
No, I represent.
I'm sorry, I would like to finish my point.
Yeah.
If you know that, at that point, then I wonder who is the person that can report that back to us and why this person is not here. But first, who is that person?
I told you that.
So Steve knows.
The hospital representative is apparently now speaking at the housing committee and will be joining us shortly. Unless you
Steve, the main reason for me saying all of that, and I will repeat it next month, because I want that to go in the minutes. We need to get answers.
Well,
Mr. Kramer, as a clinician, let me answer to you. As a clinician, I think the second question is very hard to find out. You said who died because they couldn't get the vaccines. I mean, remember, you said, well, who was over 65 years old at that point, no? I mean, but then who couldn't get the vaccines? But you could offer the vaccine to a person, say no. I mean, that you don't know, only the family will know that person want to be vaccinated and didn't get it. I mean, that we don't know. I'm more concerned going forward with my patients, those who say no, now having the vaccines that we had to offer to them, and they say no, and they go into the ICU tomorrow. I mean, I can tell you that every day, 3 persons get admitted into our hospital that were told the vaccine is here, and they say, no, I don't want it. And I'm more concerned about education going forward. I mean, because we do have the most people out there. And if you see the data from the neighborhood, I mean, in Northern Manhattan, 7 to 10 people died every day from this illness. And that I feel what we have to be concerned to be sure that we educate those who are there, who are eligible to get the vaccines. And let's press one, that the army is there to give it to them in the hands, and that they're willing to take it. And that we answer with transparency all the questions that they have or why they don't want to have it. I mean, I think that we have to do. We have to be ready to educate them, tell them, especially with the new vaccine that's coming, or is out in the market, the Johnson & Johnson, there is only one vaccine. I mean, we have to, our goal now, it should be, again, I agree with you, to be concerned, but our goal should be as educators I mean, we are all in this boat together. We are together. I mean, I consider myself a clinician, but also a community activist. And what I want to be, and to be sure that Washington Heights is the first area that can say we have 85% immunity. We have herd immunity. It's no longer a pandemic in our area. It's really an sporadic disease. And I think that together we can do it. I mean, and again, I mean, asking for the data, asking for things is very good, but going forward and say, let's be sure that we are able to give access to these people. And what you say in the beginning, the question that people didn't get it is inequality. We know that. It's not only health, it's also housing. It's also education. And there are people here.
Well, it was also the approach that you mentioned earlier that that they first reached out just to the people who were already patients. And so a large part of our community.
Part of people were able to have the time and to ask the driver, I want you to give me an appointment. And the driver will be there 8 hours to get it because they have the computers. And our people didn't have the computers. Our people doesn't know how to get in there. And that was the process in the beginning. I mean, that was a process established by the state and by the city. I mean, it's not a good process. I mean, I still have patients that say to me, I've been trying to get an appointment because they didn't know that I can give it to them. I said, oh, my son had tried for 3 days to get me an appointment. When they come to me to see me, I mean, again, we had to have more available sites, more telephones. I mean, my idea, it should be places where people can walk and get an appointment.
No, I mean, I'm told that that you can walk into the armory and you can get an appointment to come back even the next day to get the vaccine. And
you want to tell you, anybody who is 65 years old can walk tomorrow into the armory and get vaccinated. Today and tomorrow, we have hundreds of appointments, okay? I mean, open there. I mean, and that could be, I mean, but again, the questions are educations and making our community to know this. And if you will have in every building a person who is able to register on every corner and give them an appointment, don't call me. I mean, don't tell an organization, CBO, to give me a call. No. Give me an appointment in the spot.
Right.
Okay? And then if the appointment is in a week or so, give me a call 48 hours before that. That's the right approach to vaccination. The right approach is give me an appointment when I go to get one. If you cannot give me the vaccines, I hope that's tomorrow, the day after. If it's not, call me and remind me, okay, that I have an appointment.
Yeah, but the hospital had the opportunity to do that before allowing people outside of the district to get vaccinated, and they did not. That's really important point.
All right, but I don't know that we'll ever come up with those numbers. Who else has a hand raised? Darryl?
Sorry, Sally does. And if anyone else does, please raise it now.
I'll be really quick, and maybe this question is best for the hospital, but when the facility was opened at the Armory, it was a state hospital agreement. And I'm just wondering how decisions were made to first go with 65, then to go with the eligible, but never address the essential workers. And maybe that's, I don't know what the agreement.
The hospital.
But is there any oversight outside the hospital? Like, since it's a state initiative?
Public information, I can give it to you. It was an agreement between the governor and New York Hospital Association. It was an agreement that they make. And the agreement was different. Each state, the federal government gave the governor ample at the opportunity to select how they were going to do it. And each state is different. West Virginia decided to distribute the vaccines to regular pharmacy. They've been very successful to do this. The state of New York decided to give it to hospital. And that was a decision of the state of New York, and tell hospital who they will allow to get vaccinated. I mean, this is the state of New York mandated to hospital. This is what you're supposed to do and when you're supposed to do it.
Well, listen, I mean, there was a certain rationale. I mean, it wasn't completely off the wall to decide that the frontline workers, the healthcare workers, and people over 75 should be given priority. I mean, it's not that that was necessarily an erroneous decision, but but then not to be careful about people from outside the city and outside the community getting vaccinated and jumping ahead of other people within the community. That was a mistake. And I think at this point, everybody would have to admit that.
Steve, I guess my question was, and we can come back to it. I guess my question was, why was since the over 65 and the essential workers were both eligible in New York State at the same time, how was the decision made to limit it to the 65 plus? And that's what I don't know.
Yeah, I don't know that either.
And it was not 65. In the beginning, it was 75.
It was 75, yeah.
Workers, and then 2 weeks after, it was up into 65.
Right, but Sally has a legitimate question. I mean, has Anna Garcia joined us yet?
There is another question, Steve.
Okay.
Fern had her hand up.
I don't know why she would be at the housing committee for this long. Who has their hand up? Fern, go ahead.
Fern does.
Yeah. So I have 2 comments and a question. The first comment is, I think the most effective thing that's happened in our community is the network of CBOs that are getting people vaccines. And Presbyterian, I have to say, has just, CUMCM, Presbyterian, have just upgraded that portal so that we get on the spot times when people will be going. So I made an appointment today for someone for today at 5:45. I can make an appointment for tomorrow with a specific time so that it's one call, it's easy, they know when they're going, and people love it. And we're working out a couple of wrinkles, but it's going well. And we're also bringing people to the Armory because you're right, going from Inwood, going from Harlem, going from farther away is harder. And so we're facilitating that with transportation. However, everyone's point about essential workers is critical. This week, the city said that senior center, food delivery personnel, and the like, who have been frontline workers from the beginning, are now considered essential workers and need vaccines. And there's nowhere in the neighborhood to get it. You can't go to Yankee Stadium because if you're not from the Bronx, they don't serve you in Yankee Stadium. So it has to be in Manhattan. And there is nothing in our section of Manhattan for essential workers at all. The only place I know, and you can correct me if I'm wrong, that anyone can go just to say they're an essential worker is Harlem Hospital. Mm-hmm. That's the closest to us. So I echo everybody's request, demand, and advocacy, which I am doing myself, to have a lot more sites and to, okay, make some of them dedicated to essential workers, to drivers, to taxi drivers, to bodega owners. I mean, this is critical, or we're going to have more spread. It's obvious. And I want my question part, which really doesn't belong to Sandra and Rafi, is an echo of what OC and Sally are saying, which is I have asked for feedback on numbers of vaccines provided through the CBO network. And I haven't been able to get that number either.
No.
We did our own number. We know we got 1,000 people shots in the last 6 weeks, but that's only ARC 16 Fort Washington. That doesn't speak to the network of CBOs, which are over 100 right now, that are the conduits for bringing people into the Armory for shots.
Fern, one quick question. When you send clients over, do you call them back to confirm that they actually received the shots?
So they call me if they don't, because then they want to be rescheduled. I will say that we try to keep a very tight window, so it's only 2 or 3 days ahead that we're letting people know, even though when I open the portal, I have appointments that I can give people through next Saturday. I don't want to give somebody an appointment next Saturday because then I have to remember on some list, and believe me, you don't want to see my desk, that they need to be called back.
Yeah, I'm just trying to get a sense of referral and follow through, because that's the closing.
So the old system was that you got a day but not a time, and then we called the night before to confirm the time of their appointment. But with the new system, now that we can give them an exact time, it's actually working phenomenally. And I will say, to everyone's credit, that universally, anyone we have sent to the Armory who has gone to the Armory, 20% of them call us back and say thank you. It's a phenomenal experience. So that's a shout out to you guys in your partnership, working together to put in a lot of volunteers, a lot of support, and a lot of people speaking multiple languages or having the language line.
And how many people did you say ARC 16 has been able to get appointments for?
Over 1,000 in the last 6 weeks. Andy Nieto is on my board. Everybody knows that, or maybe doesn't know that. And Andy said that currently 70% of the vaccines are going into community resident arms.
Yeah, I know, but that 70% includes 16 zip codes in the Bronx, 12 zip codes in Manhattan, and we would appreciate knowing, because we're Community Board 12, and we have
that's why I asked too.
we have a particular parochial interest in Washington Heights and Inwood, which is only fair. We would like to know how many people in Washington Heights and Inwood, in our 4 zip codes, have been able to get the vaccine, which we think is only fair and would only be useful information for us to have. And just as they haven't responded to you, they haven't responded to us.
And I did ask Anna, so it'll be interesting to see if she was able to get the data.
Yeah, no, well, I mean, I'm sure they have it, but they just, for some bizarre reason, which to me is just unfathomable, they won't provide this information. But thank you, Fern. Where are we? Are there any other questions? Darren?
There are a few more questions. Sally, can you put your hand down?
I was trying to, sorry.
That's an old hand. Oh, that's okay. We have Natalie and then Barbara.
Barbara goes first.
Okay, sorry, Barbara.
Not so much a question as a comment. I've been working with Richard Allman, who works with Fern, on an ancillary effort, which picks up also, this has been going on with, I picked up a Patch article of people who aren't necessarily connected into the senior citizen network, of just contacting people in my building, starting the equivalent of the 1970s chain letters. In other words, people in my building who were like initially over 65, had they gotten the shot? No, okay. And then giving them Richard Allman's phone number. And then he, of course, is connected into the portal. And we've gotten a good handful of people in that way. And each person, I said to them, go pay forward, find 5 people in your network that you know who you can then also get registered. And I think many of them have their cousins, others, and things like that. And that's picking up people who are in the community, because I told them it should be Community Board 12 or Harlem, or maybe a little bit into the Bronx, and get them in. And Richard could comment more because he then gets the calls, that it's bringing people in. So I'm just saying, with the work the CBOs are doing, to then tell the individual people to, find other people in the neighborhood, in their networks, in their building, in their families, and pull them in. And it is working.
And Fern, are the people that Richard is helping, are they part of your 1,000?
Yes.
Okay.
In fact, Sally's been sending people to us too. Thank you, Sally.
Those people should not count.
Okay.
Sally's people.
I also want to comment that, like Fern, I've been getting calls back from people thanking me, telling me it's been a great experience, but calling other numbers didn't work for them, and that this worked, and that they were treated wonderfully. They think Richard is absolutely a miracle worker and a saint, and that he's just been wonderful to people.
Okay, Barbara, now you're going too far. You're going too far now.
Well, I'm
Okay,
telling you that it's
okay,
really
there's a-
been wonderful for
Okay,
people.
there's a
Shout out
limit
to
here.
Richard.
There's
You
a
know,
limit here.
really.
Okay, is Richard still on the call?
Other people get their shout outs, not just you.
I don't
Not
get
just-
anything. What are you talking about? I'm still running across the New England Thruway.
Dave, let me just add a quick comment or two here.
Oh, the Saint
Obviously, good,
wants to talk. Okay.
obviously good words are nice to hear.
Yeah.
I mean, Fern just did a report there. In addition to the senior centers focusing in on the clients we have served historically, there have been seniors from all over the neighborhood, both from the buildings that Barbara knows best. Fern could probably give you a whole list of other places that people have seen this as one of the more efficient ways to get vaccines and one of the more efficient ways for the vulnerable seniors and others that we particularly care about to get vaccines. I mean, the criticisms are well placed, but hasn't been much better elsewhere.
No, I mean, once you get into the armory is amazingly efficient. It's a very well run operation, and it's amazing when you think of how quickly it was organized and laid out. And you know that it's the people who planned the armory apparently did it within the space of maybe a week or less, and they did a very good job.
We have Natalie.
Natalie, go ahead, Natalie.
Steve, thank you.
Natalie?
Yes, can you hear me?
Yeah, please go ahead.
Yes. So I did forget my question because this conversation has been so lively, but I did want to say while I have the mic that my octogenarian mother was one of the 1,000 people hooked up through the ARC appointment system and had a great experience. We made a sleepover, you know, about the whole thing. And she has her second jab coming next week.
Okay, warn her that she may have side effects as I had. You know, it took me 2 or 3 days to fully recover. You know, I started out with some chills and was really fatigued for 2 or 3 days. I was so sleepy I could hardly. I couldn't leave the house for 2 or 3 days.
I think my mother's made of hardier stuff.
But you know that's good. You know, Steve, that's good, no?
No, that's good.
Yes,
Okay.
that's considered to be very good. The most side effect, I mean, that the better your body is reacting in producing antibodies. I mean, that's the scientific phenomenon. If
Well,
you
'cause,
have the
you know,
most side effect, the people have the most side effect are those ones that the body is recognizing the virus spike, and then the virus spike, and they are having more antibodies produced. Yes.
Well, you know, I tell this to some people who have had the second vaccine and who have had no side effects at all, and they then say to me, "Oh my God, I guess maybe my vaccine didn't work."
No, that doesn't mean that either.
It doesn't work that way. Okay,
Doesn't
good.
work no way. No, doesn't work.
Okay, all right. So it's good if you have the side effects, but it's also
Yeah,
good.
stronger antibodies. Remember, we don't know how long these antibodies for the vaccines are going to last. No,
Right.
we know that they are good for 6 months because now there are people who were vaccinated 6 months ago, and they're
And it's
still
still
going
working.
strong. They're still going strong. But the people in the trials, they have been monitored every 2 months now to check to see how strong are the antibodies.
All right, very good. Thank you. Daryl, anyone else with a hand up?
Nope, not that I
Okay.
see.
Okay,
And
very good.
Anna has joined us, Steve, if you were wondering.
Oh, very good. All right, well, let me just see. Pauline, did you have anything more that you needed to say?
Not at this time.
Okay, very good. And Lorraine, did you have anything? Are you still with us? All right, I guess not. All right, Anna, you're just joining us from the Housing Committee.
Indeed. Hello, everyone.
Yeah. All right. You were over at the Housing Committee for quite a while. Okay. All right. You have a report to give us?
Yes, so I am here to tell you a little bit about what we're doing around COVID and the COVID vaccine. So let's see, maybe I'll just jump to the vaccine. Is that more of interest?
Yeah, go ahead. I mean, we've already had a pretty thorough discussion, but hopefully you have something to add to it.
Okay, thank you. So just around the Armory, I think when I was here last time, we talked about our website, vaccinetogetherny.org, which is the way that many members of the public have been obtaining appointments for the vaccine. We are glad to let you know that we now also have a hotline that we've established in partnership with the Northern Manhattan Improvement Corporation. I want to share that phone number with you. It's 646-838-0319. And that is a hotline we've established just for people who live in Northern Manhattan, who are over age 65, and it's to help them make appointments at the Armory. And we've been letting our community partners know about this. It is staffed by bilingual staff from NIMIC who can help people sort of feel comfortable about the fact that they can come to the Armory, answer some questions, and get them set up with an appointment that they will be comfortable with. So we hope that that is a good service for the community, and we would appreciate your help in letting folks know about the availability of that hotline.
Well, the community board has sent it out, and I'm going to tell them to send it out at least once a week. We should continue to push it out there and let people know about it. And it's also good for the 16 zip codes in the Bronx. It's good for 12 zip codes in Manhattan and 16 zip codes in the Bronx. So it's not just for Washington Heights and Inwood.
Right. It's Harlem, Northern Manhattan, and then parts of the Bronx. You know, we've been very glad. Go ahead.
So, and how has it been working out? Do you have a sense of, do you know how many calls you've been getting up to since it opened up?
It has not been overwhelming. And so that's why we're working hard to make sure that the media know about the phone number and are pushing that number out there. We are really, you know, ready and waiting, but we have not been flooded with phone calls so far. That said, we are happy to report that we're continuing to see that about 60 to 70% of our daily appointments are from Northern Manhattan and the South Bronx. So we do know we are continuing to serve our community through the Armory, and we appreciate your partnership in that.
Is that 60% set aside apply to both the 65 plus and those with underlying conditions and comorbidities? Or is it just for the 65 plus?
First part of your question.
The 60% set aside to those zip codes, does it apply just for the 65 and older, or does it also apply to those with underlying conditions and comorbidities?
It includes the underlying condition.
Okay. And that hotline is available to them as well?
Yes.
Okay, thank you.
Where are of the other 40%, where are most of them coming from?
I do not know, but it is restricted to New York City.
Okay, not New Jersey, not Westchester.
No.
Do you refuse an appointment? How do you refuse an appointment?
When when somebody seeks an appointment, they have to tell us their address, their age, and they have to, we let them know that they're going to have to attest to having an underlying condition if that's the way that they qualify.
Do you check identification when they come, like a driver's license?
We do.
Okay, thank you.
It's there's a sort of prescribed forms of identification that have been set out by the state, and those are, you know, you have to have if you don't have a driver's license, there are alternatives, but we do ask them to confirm their address.
So how many from the 60 and 70% are from the zip code that related to Washington Heights and Inwood?
I believe 60% of that group is Northern Manhattan, Washington Heights, Inwood.
So out of the 100%, it's only 30% from Washington Heights, Inwood.
I suppose, not sure.
And in terms of the number, like the number of people?
I haven't done the math, but I know we're averaging 1,500 first doses a day.
I'm sorry, 1,500 first doses?
Per day.
So when I went for my second dose, I asked, I mean, this is anecdotal. I asked, what's the split between people who were here for first doses and second doses? I was told it was fairly even. So could there be another 1,500 who are there every day for the second dose as well?
There could be. It varies.
Oh, well. Okay, well, Anna, you know that I've requested a zip code breakdown so that we would know how many people from our 4 particular zip codes are actually getting vaccinated, so we could have a pretty good sense of how we're reaching into the immediate community. And I certainly would appreciate it if the hospital would finally provide those statistics so we could get a better sense of how well the Armory is doing outreach and how the community is responding to the availability of the Armory. I think this is important information that the community board should have, and would appreciate it if the hospital would provide it.
I will convey that.
Okay, but it's not a yes. Is that when you nod your head, is that a yes?
It is a yes that I will convey that. I don't think they're providing the zip code level data.
Why? The Department of Health has that.
We do a lot of reporting to the Department of Health.
Okay, so you report by zip code, by address, how the reporting goes, because I can only assume that if it's going to the Department of Health, that's another way to get it, which is not convenient really, but you know. To get the information, we would like to get the information. Steve, would you like to repeat your question again?
Well, how many times can I repeat it? But,
as many times as needed.
But I mean, to me, Anna, it's just incomprehensible why the hospital has a problem providing the information. I would think you'd want to be able to show how well you're doing and how well you are, in fact, taking care of people in Washington Heights and Inwood. So to me, it's just unfathomable why the hospital has any problem at all providing us with the information that we've been requesting, not only dealing with the vaccines, but also with the overall patients who are being served in the 3 facilities in our district. So you could also take that back again. And it's you know something, I've been dealing with the hospital for over 40 years. And I have never had this problem getting basic information from the hospital in all those 40 years. Maybe in the first 2 years when the hospital had a really intransigent administration. But since about 1980, I have never seen an administration refuse to provide information so basic about how you're serving the Washington Heights Inwood community. And I wish you would take that back.
Steve, Paula, is it possible to move over Erica Rodriguez from Al Taylor's office to the panel side? She's in the other attendee part. Sorry, Steve.
Okay, that's
sorry.
Fine. That's okay.
Is there? Do you have the data about how many non-Inwood Washington Heights residents got vaccinated during the period that you guys gave appointments to residents of other boroughs or cities and so forth?
I do not have that information.
Can you have that for our next meeting?
I am not sure if that is something we would provide. Can I ask more about what it is you're hoping to get at? I mean, I
asked my question first, and I think we deserve an answer. And I think we're not getting answered, and it's very, very beyond just disappointing. So excuse me if I sound a little bit like too, you know, out, I don't know. But I mean, we have the right to get that information as community board serving our community. We feel like we are missing that information, and maybe that will be something that can help us see what can we do to get more people from our community vaccinated. But it seems like there is a pushback of not giving the data. So, and there is nothing wrong with like asking those questions and receiving the data. It's our community, so I'm not sure where the problem is. I also don't understand why we can't get information about how many people from our community died because they didn't get vaccinated when they could, when they couldn't, because vaccines were not available for them, was giving to other residents of Long Island, Connecticut, Westchester.
Yeah.
I am sure you have this data. I'm absolutely certain.
Well, I'm
Steve,
not.
I don't, please, let's see what answer we get. And this is all going in the minutes.
I mean, we have shared that 70% of our appointments are going to individuals in the priority zones.
That's not priority zones. We want to know Washington Heights Inwood. Priority zone that you're talking about is like Inwood, Harlem, Washington Heights, and the Bronx. We want to know Inwood, you know,
60
please.
And the 70% are coming from Washington Heights and Inwood. But I didn't calculate the number.
Well, it would certainly be more reassuring if we could actually see the numbers.
But just a few minutes ago, we said that 30%, about half of them are coming from Washington Heights and Inwood. So from 100%, it's about 30. So what is that 30? What's the number?
Well, she doesn't have the number right now.
I'm sorry to say that, but I do not believe that.
Well,
the number is somewhere, and it just don't want to give us the number.
Oh, yeah, I agree. I'm sure the number is available and is accessible to them, but they don't, for some reason, they won't provide it.
We are averaging 1,500 doses a day. We are on daily average, 70% of those doses are going to people in the priority zones, and 63% of that 70% is Northern Manhattan.
And you define Northern Manhattan as being the 4 zip codes?
Washington Heights and Inwood, yeah.
What's the zip codes that you define that as Washington Heights Inwood?
I don't have that at my fingertips here.
Can you have that info for next month meeting?
Sure.
All right, but it's 60% of the 70%. You're saying are from Washington Heights and Inwood. Is that correct?
Right. That's the average, the daily average.
Yeah. All right. Well,
if all the numbers make sense, it's 20,000 people.
Well,
since the beginning of vaccination, you mean?
Well,
No,
I don't know.
only the last 6 weeks. I'm doing the statistics based on the last 6 weeks because I know that that's been the push and the successful push to be at 60 to 70%. And using those numbers, I just did the arithmetic on a little piece of paper and came up with roughly 20,000 in the last 6 weeks.
Okay, so that's about, Steve, that's about 10% of Inwood Washington Heights population. But that's total population. Hold on.
That's
it's
right.
just total population.
Which matches Steve's statistics on how many people in the zips have gotten 2 doses of vaccines.
Right, but
well,
220,000 people live in the district, but that's everyone, including children. So that percentage is not
It's
right.
roughly just in Washington Heights and Inwood, because I live with these numbers all the time. It's roughly 26 to 28,000 older adults.
Right.
Assuming that only in the last week have we released that to people with comorbidities, or they released it to people with comorbidities, it still means that roughly half of our older adults have been vaccinated.
Well, it would be good not to have to sit here and guess and try to come up with numbers and just have the hospital quickly run them off and provide them to us. Anna, did you have anything more to report on?
We are continuing to do talks for the community around vaccine hesitancy. If anybody is interested in having a talk for their, be it housing group or community-based organization or faith-based group, we are very happy to provide that service. You can just reach out to me for that.
And I'm sorry, these are talks on
emergency. So, and if people have concerns about the vaccine, we're happy to talk to you and talk through those concerns.
And can I just reiterate that we wanted the number of people referred by CBOs broadly? I only know the numbers for my CBO. In Washington Heights and Inwood. I want to stick with my community board colleagues.
Well, I mean, I like the fact that the hospital is utilizing CBOs. And it's proven to be very effective, and it is a good way to reach out into the community. But it also poses a challenge because you're reaching people who are already involved and who already have some affiliations, and there's still a large segment of the population that still needs to be reached in order for us to have to reach herd immunity.
Yes, that's why we're enrolling them in the senior center so that we can track.
Right.
And for those that we need to reinforce the appointment, we can call them back and say,
Right.
Remember you have an appointment tomorrow.
Are the senior centers open? Can people walk in? And so even there's an impediment right there. You can't just walk in and talk to somebody face to face and ask them for help to get an appointment. They have
That's
to know.
correct.
They have to know to call you up.
So I will say that the complexes in our neighborhood have been really great. Where there are building complexes, they gave everybody my home cell phone. I get calls, lots of calls every day myself, because they are putting out the word that the senior centers are helping people enroll, and some of the synagogues, a lot of churches. So the word is getting out there, but it's very word of mouth.
Right. Anna, do you have anything to tell us about how the hospital has been able to treat the people who have been found with the variant that was recently discovered at the medical center?
We are continuing to follow the existing protocols. We don't have new information about new ways that they would need to be treated.
No, but are these people isolated from the rest of the population? Do you put them? Do you take them away from the rest of the patient population, including those that have COVID-19? How do you make sure that they don't transmit to others?
I don't have information on anything new that is happening in relation to the variant. I don't know if maybe you talked with Dr. Lantigua about that earlier.
Yeah, but not on this particular point.
I am not aware of any new guidelines that hospitals have received around this.
Maybe there are old guidelines. I mean, wouldn't you have to do something when you find a situation like this with a mutation and make sure that they don't mix in or possibly affect anyone else in the hospital?
I do not know if this mutation merits any different infection control procedure than what we already had in place.
Could you find out for us?
Sure.
And according to the New York Times report, based on Dr. Ho's findings, there must have been at least 137 or more people found with this variant. Do we know whether or not they've been able to recover, and whether you've been able to successfully treat them?
I don't have information on Dr. Ho's group. I don't know if the other presentation got into that level, but we certainly wouldn't share information about that.
All right.
For next month.
I unfortunately assumed there was information the hospital would have and that it would want to have. All right, thank you.
Just say that you will get the information for us, right? Assuming for next month meeting, right? Can we put that in a minute so we won't forget?
Okay.
Thank you.
All right, Anna, anything else you might have for us?
No, I think that's it, unless you have any other questions.
I had a question.
Go ahead.
Okay, the last time you were here was when y'all were contemplating whether or not you would open, I guess, the vaccine beyond the 65 plus population, which you did subsequently. You opened it up, I guess, a week after you went statewide to include those with comorbidities and underlying conditions. My question is, why was the decision made by the hospital, and how was the decision made not to include front-facing essential workers, especially given in our community board district, we have the fourth highest percentage in the city. So I'm wondering if y'all are contemplating that now, and how have you not addressed that population to date?
I don't, I think that we followed the governor's guidance on then opening it up to our patients and members of the community that have comorbidities and underlying conditions. And we have, of course, been vaccinating our own healthcare staff. I don't have information on whether we'll be opening it up to first responders or other people in category 1B at this time.
Okay.
No, we're talking about essential workers, taxi cab drivers, grocery workers, home care workers.
Some healthcare aides.
Yeah, I mean, I assume it has to do with our allotment of vaccines. Like, I don't believe we got more vaccines just because we added category 1B or the underlying conditions.
Right. Thank you.
Okay, any other questions? All right. All right, thank you.
Welcome.
Is Janelle Edwards on the call? Did we lose her?
No, I'm still here, Steve. How are you?
All right, go ahead.
Thank you so much for having us here. And I know this has been a really interesting meeting, and a lot of you have very important questions to ask. So I already know that Dr. Lantigua touched the questions on the vaccine. So I'm just going to give a really brief update regarding some of the programs that we currently have operating. And I also included that in a report which I sent to you, which you can send around to the other members.
Okay, you already sent me that report?
Yes, I did.
Okay.
Okay. So
right,
just, oh, go ahead. I'm sorry.
No, so I'll forward the report to the other committee members.
Okay, wonderful. I just wanted to highlight a few things for the committee. Some of you had an opportunity to join the committee health workers town hall, which was focused on the COVID-19 vaccine, which happened literally right before this evening's meeting. We had a number of experts from the hospital, from the medical center, and along with Congressman Espaillat and DMC from the group Run DMC, who I'm sure most of you heard of, just to speak to health workers about the vaccine, answer any questions that they may have. This will be part of an ongoing series to target the community health worker population. We expect the next one to be around April 8th, so that information will be forthcoming, where we'll feature breakout rooms, and the health workers will have an opportunity to speak amongst themselves and continue the work that they're doing. The application for the 2021 Medical Center Neighborhood Fund is open. All of you are, for the most part, pretty familiar with the terms of the application. The application is open until March 26th, and it's now available online. If you know of anyone who needs it, you can contact me directly, and I'd be more than happy to send it to them. But the link will also be available in the report which I sent to Steve. Another project that program that we help promote is Project REACH, which is being run by the Irving Institute for Clinical and Translational Research. This is also geared for local CBOs to provide operation and other sort of support. That application is open until March 22nd. Another program is the Alela Bundles Community Scholars, and that's also designed to offer scholarship-based support to independent scholars in Northern Manhattan. That application is due April 30th, and there's an upcoming information session on March 17th where those interested can get more information. This past Sunday on the 28th, another COVID-19 vaccine town hall was held in partnership with the Williamsbridge NAACP. It featured Dr. Fulila from the Mailman School of Public Health, along with Dr. Kelly Bryant, who many of you are also familiar with, just to speak about hesitancy, particularly in the Black and Brown communities, and to answer the questions. I also included a brief snapshot of the campus testing data. So this is only specific to the university campus, including the medical center and Morningside. If you are interested, that information is included there.
What did you say Kelly Bryant is doing?
Well, we just missed her event. She was partnering with the Williamsbridge NAACP. That occurred on February 28th. I'm still waiting for an edited version of that town hall. And once I receive it, it will be up on our social media and our website, and I can also send it to you.
Well, but okay, but you know, we love Kelly Bryant.
Yes, I know. she's a star.
Okay. All right. And so all of the stuff that you just mentioned is also in your report, is it not?
It is, yes.
Okay,
I didn't want to bore everyone with the minutia, but it's all included there, and you can follow up with me if you have questions.
Okay. All right. Now let me see if Betty Lehman has a report, and then we'll come back to you for the presentation on Alzheimer's disease.
Okay, great.
Betty, are you with us? I thought I saw Betty Lehman before.
She is. She's just unmuting. Oh, she's going to call.
Can't hear you, Betty.
Are you calling Steve or Paola?
No,
she has to unmute herself from her computer. I can't do nothing. I'm not muted. She's not muted from here.
Yeah.
She's calling.
Where would she be calling?
I don't know.
Betty, can you type in a Q&A who you're calling?
She can't.
She might be calling into the meetings call line.
While we're waiting, why don't we go to the next thing?
Okay, very good. All right, so Dr. Martinez, are you with us?
Yeah, I'm here.
Okay, very good.
I will present Dr. Rith. She is the presenter for the Alzheimer's talk.
Oh, it's not you?
It's Dr. Rith. She's here. I am her. I will present the program.
Betty can speak now. She unmuted herself. I just saw the screen microphone go off.
Oh, okay. Dr. Martinez, hold on for a moment. We'll be right back to you.
Okay, thank you.
After this commercial from the Isabella Geriatric Center. Betty, are you now back? Are you with us again? Hello, Betty.
Say something, Betty. See if we can hear you.
Anything at all? Abracadabra, anything you'd like.
I think it's her computer. Maybe her settings or her stuff is off.
Oh gosh. Okay. Well, let nobody ever say that that Betty's settings are off. All right. So Dr. Martinez, who in fact is making the presentation?
Dr. Rith. She's here. Dr. Christiane Rith. She's a neurology at Columbia University.
Okay. Slowly now. What is her first name?
Christiane
Rith.
Oh God. Spell that for me.
CHRISTIANE.
Christiane. CH. Oh, hold it. Oh, there you are in person, and your name is there. Perfect.
Okay.
R-E-I-T-Z.
I have it on my slide, so.
Oh, very good.
Yeah,
Okay.
Steve, it was included in the slides. So
It's
all the
it's in the
spelling of her
PowerPoint?
full.
Yes.
Sorry, my child is
And,
there.
and this is after I gave Dr. Who is that? Okay. Okay. Do we still have Dr. Reitz or did I lose her?
I'm still here.
Okay. I can no longer see you, but okay. Are you able to share the screen with your presentation?
Yes, can you see it?
Yes, now I can. Can everyone else see it?
Yes.
Okay. Okay, Dr. Reitz is Associate Professor of Neurology and Epidemiology at Columbia.
Yes, exactly.
Very good. All right, so all right, we'll go ahead now and let us get the benefit of your presentation.
Okay, good. So first of all, thank you so much for the invitation and for having us. I'm working at Columbia University. I'm part of the Department of Neurology and the TAUP Institute. And, our group is focused on research on Alzheimer's disease, in particular in communities of color. And I'm actually working closely with Dr. Lantigua too. We just wanted to give you really like a brief overview of Alzheimer's disease, topics and questions that are concerns, really for the community, and then also talk a little bit about the research we're actually doing at Columbia University. So, one of the questions obviously we always get is what's the difference between Alzheimer's disease and dementia, and that's something many people have a question about. And
Yes.
Dementia is really more like an umbrella term, which simply means problems with your memory. But then there are lots of different causes of of dementia. So, for example, stroke causes dementia, Parkinson's disease causes dementia, and Alzheimer's disease is simply the most frequent cause of dementia, accounting for up to 75% of all cases. Obviously, all of us, forget things from time to time. So one question often is, what's really the difference between normal aging and the memory loss that comes with normal aging, and the difference to Alzheimer's disease. And the main difference really is that, it's normal to forget things from time to time, but really the difference is, if there's like a new change to that, and if there's a consistent change to the memory function as compared to before. So there are 10 different signs, usually what we say of Alzheimer's disease, which I'm showing here, which are first symptoms of Alzheimer's disease and symptoms we are seeing throughout the disease. And this is really what people should look out for. So here on the first picture, you see that's like a person. She needs to kind of put Post-its really in order to remember things. That wasn't the case before, but now she needs Post-its to remember things. So it's really, memory loss that really affects day-to-day ability, and people forget things often and really struggle also to retain new information. Then the second picture here is really difficulty performing familiar tasks. So, he always prepared the eggs himself, but now he really doesn't know what are the different steps I need to take in order to really achieve the results. So it's really forgetting on how to do something you've really been doing your whole life, such as preparing a meal. So number 3 is, problems with language, that, she's holding up a cat, but she doesn't really know what the name for this object is. So really problems with, forgetting words, and problems with naming objects. Then people get lost, so really disorientation geographically, but also in terms of time. Not knowing what the date is, not knowing what the day of the week is, but then also people often get lost. Even if they've lived in the neighborhood for 30 years, they are getting to the point that they don't find their way home, they don't find their way to the grocery store, and so on. Number 5, problems with judgment. So this is a little bit hard to see, but it's actually snowing outside and she's not dressed appropriately. So really making the right decision for a situation. Knowing that, you know, you have to dress, for example, how you have to dress, for example, like in a winter storm, as an example. Then problems with calculations. So even people who were always, you know, good at math and could pay their bills have suddenly problems with paying their bills and, you know, and doing simple calculations. Then people often misplace things. And then these are the last 3 pictures here. Is really what we are often seeing is changes in mood and behavior. So that people have mood swings, that they are behaving out of character, so that they become confused or suspicious or fearful or aggressive. And often also what we see is really loss of initiative, that people really lose interest in friends, families, and favorite activities. So these are really the common signs we are seeing in people with dementia, and these are signs people should be looking out for. So these are just for the numbers. So in the US, there are about 6 million people right now with Alzheimer's disease. Alzheimer's disease is the 6th leading cause of death, and that means that about about every 67 seconds somebody develops the disease right now. There are 2 different forms of the disease. You know, the form we all of us know is really the late onset, what we call the late onset form of disease, which occurs in seniors over the age of 65. That really makes up about 95% of all cases. But then there's also early onset form, which runs in families and where people get the disease in even sometimes their late 20s or early 30s. And that's highly genetic, and of course that's really an immense burden on the family, because often several people in the family are affected. So you know, I'm skipping this one here. So so there are a few different medications for this, but all of these medications, you know, alleviate symptoms, different kinds of symptoms, but as we all know, there's not a cure yet for the disease, unfortunately. So what we think in terms of risk factors is that it's a mix of genetic risk factors and environmental risk factors and other comorbidities, such as diabetes, for example, and hypertension. But a large part of this is going to be genetics. The main risk factor, of course, is age. As we know, the risk of Alzheimer's disease increases with age. So over the age of 65, about 1 in 9 seniors develops the disease, but then over the age of 85, it's already 1 in 3 seniors. So age is the strongest risk factor, and it really significantly, the risk increases with age. So what many people don't know is that 2/3 of people with Alzheimer's disease are women. So there's a higher risk in women than men. Of course, one of the questions is, why is that the case? So we believe it's partly due to hormonal factors, but then also due to other genetic factors, which lead to this difference in risk, which we are seeing. So there's a lot of research going into differences between sexes. So Alzheimer's disease is the only cause of death in the top 10 diseases that cannot be prevented or cured. So for cancer, heart disease, and stroke, deaths really have increased because the treatments have become so much better over the last 2 decades. With Alzheimer's disease, the number of deaths actually has increased. The reason for that obviously being that we don't have a cure, and that people get older and the population is aging. So this is what we're expecting to happen over the next 2 or 3 decades. So right now, as I said, we're about 6 million cases, and we're expecting this number to actually triple or quadruple by 2050, leading to about 60 million cases just in the US. So Alzheimer's disease is the most expensive disease in America because people because it's so frequent and people survive for a long time and live with the disease for a long time. But at the same time being, becoming fully dependent on caregivers. So right now, Alzheimer's disease this year, for example, will cost the US about 290 billion, but then in 2050, this is going to increase up to like 1.1 trillion. So it's devastating for the health system. Then it really impacts our communities also on a different level, which is with the caregiver level. It's extremely burdensome for caregivers. Caregivers provide more than 15 million, more than 50 million Americans provide unpaid care for someone with Alzheimer's disease. And that usually means 24/7 care. So what's happening is that many caregivers need to drop out of work and leave the workforce. And by that, they obviously lose a huge part of their annual income. And on average, caregivers lose $15,000 of annual income, which obviously is an additional level of burden on these families. In addition to this financial toll of on caregivers, there's also significant health consequences for caregivers, which is really a problem in the community. So 35% of caregivers really get sick and report that their health has gotten worse. We're seeing psychiatric disorders, a lot of depression, anxiety, fatigue, and social isolation. But then also other health problems such as high blood pressure, which is frequently associated with caregiving. As I said, one of the main research areas we're working on is Alzheimer's disease in communities of colors and diverse communities. And the reason is that Alzheimer's disease has a particularly high impact on African Americans and Hispanics. So the risk of in these communities, in these ethnic groups, is twice the risk of Alzheimer's disease in non-Hispanic whites. African Americans and Hispanics are also more likely to have multiple cases in the families compared to non-Hispanic whites. So meaning that there's also, in terms of the number of people affected per family, there's a much higher burden in these ethnic groups compared to non-Hispanic.
All right. Did something just happen?
Yeah, she got disconnected.
Which means that there's a reduction of, an effectiveness of treatment. And that means, all this obviously means that Alzheimer's disease also puts a particularly high financial toll on these ethnic groups. So one reason, obviously a significant question is, why are these ethnic groups at such a high risk? And what are the risk factors driving these associations? So Alzheimer's disease is linked to several risk factors where we know that they are more frequent in African Americans and Hispanics, and that's diabetes, heart disease, hypertension, and stroke. So all these increase the risk of Alzheimer's. There are genes that we know that a large
Maybe
part of
she could turn her video off. Might help with. You keep breaking up.
Oh, yeah. Okay, I do. Okay, good. Oh, looks like it's now freezing. Can you hear me?
Yes.
I can hear you, yes.
Yeah, it's it looks like right now it's actually, okay. For some reason, it's freezing on my end here. Um,
Dr. Reitz? Is this, Dr. Reitz, is this the end of the presentation?
Actually, it's not the end. It's almost there, but what I can do is maybe I can call her and she can finish the presentation. And then if you have any
can
question.
you hear me now?
Yes.
Yes.
Okay, good. I don't know what happened, but my screen froze.
Oh.
Okay, so I'm turning off my video. Okay, can you see my screen now?
No.
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 Okay, good. Okay, can you see it now?
Yes.
Okay, good. Okay, so I think that's where we were. So part of this is, you know, the high risk in African Americans and Hispanics is due to these risk factors: diabetes, heart disease, hypertension, and stroke. But then the other part is also genetic. That we know that there are differences in genetic makeup that drive this high risk. So this is the reason why, you know, we are doing so much research in our communities of color, in particular African Americans and Hispanics. And the main goal of the studies we are doing at Columbia is to understand the costs and the risk factors of the disease, obviously, in order to identify and develop better and more efficient treatments. And we are doing a lot of genetic studies, and the reasons for that is really the precision medicine. I think all of you have heard about this and know what this means, but that means that instead of really applying a one-size-fits-all approach and everybody with Alzheimer's disease is getting the same medication, which is the case right now. It's really that we're trying to get to the point where we are in cancer research, in cancer therapy already for almost a decade, that we really look at the genetic makeup of a patient and then based on that select the best treatment for that person. And so this is kind of what you're seeing here. So the idea is really that, you know, at some point, hopefully in the next couple of years, you know, a patient would come to the doctor, we take the blood, we look at their genes and their genetic makeup, and based on that, assign a therapy which is much more, which is working much better for the patient than what we're actually seeing right now, where like everybody really gets the same medication. So, you know, obviously, if we're doing that, we need to first identify the genes and that are causing Alzheimer's disease. And the important thing is to really do this with, you know, for each ethnic group, because what we know is that genes which we identify in whites do not necessarily translate to genes causing Alzheimer's disease in other ethnic groups, and that's why it's so critical to do these genetic studies separately in all ethnic groups. Most of the studies, and this is not only in Alzheimer's disease, but pretty much across all diseases, most of the genetic studies have been done in non-Hispanic whites. But there's really a critical need for similar studies in African Americans, Hispanics, Asians, and other ethnic groups in order to identify within ethnic groups the genes that cause the disease, so that we can develop ethnic group specific efficient treatments. So this is really what we're working on. Why are genes so important? You know, because genes really are at the root of the biology. So if we know the genes, we know what's going wrong in the brain and why it's going wrong. And this is, and so basically, if we identify genes that are different between persons with and without the disease, then we know We know what the genes are doing, so we know what's going wrong and why that's the case. And often these genes are really also targets, good therapeutic targets for gene therapy. So this is really where we are going with this. So we have discovered now over 30 genes. And these genes tell us the biological pathways that are involved. And in Alzheimer's disease, what we know now, and this is really based on genetic studies we have done over the last 5 to 10 years, is that inflammation and cholesterol plays a big role in Alzheimer's disease, but also communication between brain cells. And all this we really know from genetic studies.
Dr. Reitz, are you saying that that the research being done at Columbia itself has resulted in the discovery of more than the 30 genes? That this all happened at Columbia?
This is what we are doing is, and this is for most of the genetic studies. So we are working usually on multi-site projects. So we are working with the other leading sites in the US, and we are all putting our samples together, analyze them together in order to really have the largest study we can do, and work collaboratively. And our studies have been a big part of these identification of these genes.
You're working collaboratively with people elsewhere around the country.
At UPenn, Miami, for example, yes.
Okay.
So it's really, so we are mostly working in, and the reason for that is just simply for genetics. You really need large sample sizes, really with thousands and thousands of people, and that's why we are pooling and collaborate and work in consortia in order to really do these genetic studies.
And let me just ask you, is it somewhat unusual that you would identify 30 different genes that might be responsible for a particular disease?
No, it really depends on the disease. So there are diseases where, one gene is causing the disease in everybody, okay?
Right.
But then most of the diseases, like, for example, diabetes, there have been hundreds of genes now identified that are associated with diabetes.
Okay.
The same thing with stroke or heart disease.
Okay.
So there are diseases where we know that it's hundreds of genes, which each of them have a small effect, but they add up together, causing the disease. And Alzheimer's disease is one of those, and we call them complex diseases because it's hundreds of genes involved. So it's a very common concept. And that's what we are seeing in Alzheimer's disease too. It's not one gene, it's hundreds.
So you might have a great deal more work to identify dozens of more genes.
Exactly.
Really? Okay.
Right. Exactly. Well, so that's where we are.
Well, I think you're going to have a job for the next 40 years.
That's the good side about it. That's true. Yes. So there's clearly a lot of more work done. And also the problem is that these 30 genes, most of these were identified in non-Hispanic whites. And so that's why our work in these communities and also in Washington Heights, Harlem and so on is so important because we really need to do these studies in these other ethnic groups too. And the good thing about it is that in the last 5 years, the NIH really has picked up on that, and there's a lot of funding. So we're getting a lot of funding for doing this now. And it's just so important. And that's why these outreach events we are doing, we're working with the Alzheimer's Association, with Caring Kind and so on, is so important because we need to get through these communities to be able to do this research. So this is.
Are you working with the local program we have for, it's an Alzheimer's daycare program for caregivers at 99 Fort Washington Avenue at 163rd Street, the Riverstone Senior Life Center? Are you working with them?
Yes, we have worked with them, not regularly, but yes.
All right, very good.
Yes. Yeah, so this is one of the large studies we are doing, which is called the NI-LOAD study, and the NIA just simply stands for National Institute of Aging Study. So it's a study which is funded by the National Institute of Aging and was initiated by that institute, and it's been ongoing for over 20 years. And it's one of it's basically the leading study in the US and one of the major studies in the US, in the world. And it's one of the largest and most frequently used Alzheimer's disease genetics data sets. And this really started out about 20 years ago with the goal to recruit families which are multiply affected with Alzheimer's disease, because, you know, families, the theory behind that is that families are really loaded for these genetic causes of the disease. We have more than 1,400 families in this study now, and it's been really important data set for these gene discoveries. And now we're expanding this data sets to communities, to African Americans and to Hispanics, and also to non-familiar cases. So this is really a study we are doing, and this is a study where we are working in the communities with, recruit participants into this large data set, into this large study, in order to identify the additional genes in the different ethnic groups. So this is pretty much, you know, what we're doing. We're also helping people to, you know, because often we're coming across the situation that people do have concerns, but they don't know who to turn to. So we're also helping participants or people from the community to see the right doctor for this.
All right. Well,
This is all I have. I'm happy to answer any questions you might have.
well, I'm going to take some time to review the PowerPoint more carefully, and there's a good chance that you'll be hearing from me as I put together the
Yes,
minutes
more
of
than
this
happy.
meeting. And I also want to talk. Is Sandra still on the call? All
No,
right.
Sandra is not on, Steve.
All right.
It's just me.
All right, she escaped.
She did, yes.
Okay, so Janelle, let me review the PowerPoint again, and maybe we'll talk among our committee members to figure out how we can be helpful to recruit more people for the study, since it is so important. And I appreciate you bringing this before us. This Daryl and I think other people will remember that a couple of years back when we reviewed the city's community health profile for Washington Heights and Inwood, I think several of us were startled that one of the greatest causes of death in the community, maybe it was the fourth most common cause of death, was Alzheimer's. Well, I think none of us really thought of Alzheimer's in that context, and we were pretty stunned. I was pretty. I think it's fair to say that I was stunned to see that it was that it ranked so high as in our community in particular, not necessarily around the city, but in Washington Heights and Inwood, it ranked very high as a cause of death.
It was number 4, Steve.
Oh, hey, I remember. So I don't qualify for the study then. Are
We
there
did
any
have some hands, Steve.
Yeah, please, yeah, let's call on people, please.
I see OC, Tanya, and is the phone Betty? Someone's on a phone.
All right, let's say it's Betty, but let's start out with OC.
I'm on the phone, yeah.
Oh,
I have a
wonderful.
question.
Okay.
Oh,
Can
Betty,
you
go
stop
ahead.
the screen share?
Yeah, can you stop? Yeah. Betty, why don't you go since you haven't spoken yet?
Yes, go
Yes,
to
I
Betty.
just wanted to ask a question. I work at Isabella Geriatric Center, and we have a couple of units of people with dementia. Are your studies focusing mostly on people living in the community, or can you take into account people that are in facilities being treated for dementia?
Both, anybody, yes.
Oh, okay, that's good to know. I will have a conversation with our Director of Dementia Services tomorrow and see if we can possibly get back to you with some possible interest. in,
Perfect.
in
Yes.
developing?
Yes. No, we
Okay.
work a lot with senior centers, nursing homes.
You do?
Yeah.
Okay, and who should I reach,
That would be wonderful, yes.
who should I reach out to? Christine, Dr. Christine?
Yes, so Dr. Martinez, ideally, or Dr. Fonseca were both on the call here.
Okay.
Yeah, we on the presentation, on the last slide, there is information like my email.
Okay.
So you can email me or email Sandra Fonseca.
Yeah.
There are.
Okay.
All right, very good. All right, so
Okay.
already we've made a match here. Did OC, you have a question?
Tanya was before me.
Oh, Tanya, go ahead.
I actually, just had a comment. I wanted to say that, looking at your presentation, especially the part about the caregivers, I think that it's just a need. There's going to be a great need for us to rethink our social safety net. Because like right now, like even with Medicare, like there are people who can get caregivers that can get paid to, who do the care for their for someone in the household. But that's only for people who qualify, if those patients or if those family members qualify for Medicaid. But, the social safety net needs to be expanded. We need to think more about how other people outside of that tier, economic tier, can be covered, to do this work, to care for relatives and other loved ones who are dealing with Alzheimer's, because it's, as you say, with the numbers being tripling, it's going to be something that we think about, maybe even with our healthcare system, our insurance system, Obamacare, changes that need to be made. So that's just my reaction. That's all.
Yeah,
yes, very important.
Yes, it's a good piece of insight. OC, are you next?
Yes. Question. I just wonder if that Alzheimer has any connection to environmental, like issues like elevation of CO2. And if you have any data that is related to, again, I'm going by zip code, but it doesn't have to be necessarily by zip code, maybe more like addresses in our community, because we know that along the Highway 95, there is more elevation of CO2. And back many years ago, when Park started the Million Trees NYC, that in our district, they start planting those trees along, more or less along 95 before going elsewhere. So I wonder if that disease has any relation to CO2 or any other emission, and if you have any data that related to either zip code or address it.
So there have been studies on, for example, air pollution, these kind of things, and toxins and so on, in relation to Alzheimer's disease. The data are very weak, so there's not consistent associations been found. So it's an area of research, but it doesn't seem that there's a strong association.
Okay.
And
Okay,
I had a couple questions.
Yeah, go ahead, Darren.
I guess along the lines with OC, is there any like occupational connection related to maybe military service or sports where there's head injuries, that sort of thing?
Yes. So clearly, I mean, what we know is that, head injuries, traumatic head injuries clearly increase the risk of dementia. It's a problem in the military, it's a problem in sports. So any kind of repeated, usually not like a one time, unless it's something really like a significant injury as a military. But for example, in terms of sports, it's really it's repeated injuries, for example, like in football, that they kind of bang their heads again and again and again, or like boxing. There's clear data showing that.
I'm sorry, what's the last thing you said? There's clearly what?
There's clear evidence that there's an
clear evidence.
association. Yeah, that traumatic brain injury increased the risk of dementia, clearly.
And then my other question was specifically about the death aspect from this disease? What does that look like exactly? Because people associate this with obviously loss of memory. Like what causes actual death?
The death. Okay, so what's happening is that people, start out with memory problems, right? It becomes worse and worse and worse up to the point that, it's not only that they can't remember things, but they also cannot really do any kind of task. They cannot rest themselves and so on. And then that gets worse and worse and worse. Then at some point they're completely losing their language. And become mute, and then they become bedridden. Because basically their brain is destroyed so much that the whole body stops functioning. So they become bedridden, they are mute, and they also stop eating from the disease because, they don't remember to eat, but then also the appetite, they don't have appetite anymore. And this is really how death occurs, that really like slowly the whole body shuts down in different stages. And once they are bedridden, they often get like pneumonia and other kinds of infections and so on. And this is a process, but usually it's depending on the disease. It's 8 or 10 years, right? In the yeah.
All right. And do we have anyone else, Darryl?
I think all the hands that are up are old hands. And
well,
I didn't mean that derogatorily.
I'm
just checking the chat real quick. No, I don't think there's anything.
No reason to denigrate old hands.
Moisturize.
Especially in this context, maybe. All right. Well, Dr. Reitz and Dr. Martinez, thank you very much. And I think we're going to want to hear more from you as time goes on as to how you're progressing and how many more genes you've found. And I'd like to be able to, as I said before, figure out how we can be helpful to you in getting the word out. And I think just tonight, maybe we've already been helpful and will be helpful with Betty linking you to people at Isabella.
Yeah, I just want to say that thank you for allowing us to be here. And the decision of presenting this to you here at the board is because we know you guys are leader in our community, and they are a huge topic now with diversity, and we're working in actually addressing diversity in all of the sense. So one of them is Alzheimer's. So if we know how to treat white, why not white to treat Black and Hispanic? So this is important, and I think as a community leaders, we open to do events with your community. And as now we're working like with the, churches, nursing homes and things like that. So please take our names and use us as your preference.
All right. Well,
Thank you.
I appreciate the fact that you thought enough of us that that you wanted to come before us and give us this presentation. And as I say, I appreciate the work you're doing. I was unaware of it, and I'm glad to see that you are doing this work and realizing the importance of reaching out to a larger field of people to make sure that whatever cures and treatments we come up with are helpful to the broad population that is affected by this disease. So we appreciate the work that you're doing.
Thank you.
All right, so we'll certainly be in touch, and I'll be in touch with Janelle if I'm not in touch with you. Thank you so much.
You're welcome. Thank you for having us.
Thank you. Yeah, thank you very much.
And really, if you haven't touched base with the people at Riverstone recently, I encourage you to go back there, because that seems to be also a natural place for you to have an ongoing relationship.
We will.
Yes.
And can we get the presentation?
Yes, I'll send it around.
Thank you.
And please do not hesitate if you have any question on it. Send us a question.
No. I think, as you may have already seen tonight, we're not very hesitant.
I see. Yes,
I,
thank you.
I-
And I do like that. So that's good because that means you guys are on top of things and that's great for our community. That's
Well,
why we
okay,
trust the board.
okay. Well, we
Thank you.
try, even though there are some people who don't seem to appreciate our activism. But thank you so much.
Thank you. So quick time check. It's 9:03. It looks
Okay.
like Betty was ready to go.
Okay, Betty, come back
Yeah.
to us.
Can you hear me?
Yes, but beautifully, yes.
Okay.
Go ahead.
Sorry about that. I could hear everything on my speakers, but for whatever reason, the output wasn't there. So I apologize for the delay. Okay, at Isabella. Well, our community, let me talk about two things. Our community-based programs and then what's happening at the nursing home. Our community-based programs, of which we have 3 NORC programs, they're continuing to operate as they have throughout the 13 months we've been living in this hell. And they've been doing so on a virtual basis. So we make client contacts. We have about 1,000 people in 3 NORC programs, and we're in constant contact with them to provide support, etc.
And are you telling these people to go get vaccines?
Yes. Oh, yes. We've been working with Presbyterian very closely. As you know, in conjunction with what Fern was talking about, we have our own hotline with, there are several hotlines for the CBOs, and we have several as well for our various programs, and it's been working very well. We've been very happy with Presbyterian and the Armory. So I have to say, we have no complaint there.
Okay, but
we have another.
And you are encouraging those 1,000 people to get.
Oh,
you're,
yeah.
You're helping them get the appointments so that they can get vaccinated.
In the first week this has been open now about 3 weeks. In the first week alone, there were 135 people that got shots. And I know it's grown. I haven't gotten the number since then, but I know it's a lot more than that. Probably, I'm going to say over 500 people at least on the NORC program.
Just in those 3 programs, very good.
Yeah. Now
And
we
that-
have
that
another
would-
program.
That would include the one down near me at River Terrace?
Yes.
Oh, very good.
Mhm.
Okay.
Excuse me. We have another program called the Upper Manhattan Partnership for Senior Independence. We have about 1,000 clients. Most of them are homebound, but we work with them on a remote basis, on a phone basis, and get them connected to vital services. I'm very happy to hear from Dr. Lantigua tonight, that there's a plan coming about to be able to deliver vaccines to people in their homes, because that's the majority of the people in this program. They're really unable to get out. So this will be very helpful.
Right.
We are also working, we have another division, not Isabella, but our parent, called Elder Plan Home First. And they've been working with Somos Community Care, which is Dr. Talaj.
Right.
And we've been volunteering our staff to go out with Somos all over the city, including Northern Manhattan and Washington Heights, obviously, to provide vaccines. So wherever Somos goes, the staff that's there is staff from Elder Plan and Home First. So that's just something for you to know about. Anyway, as far as the nursing home is concerned, you've probably read recently that there's a plan afoot to be able to welcome, finally, visitors to see patients face to face, as opposed to with window visits, which window visits, as you may recall, started last summer, and family members could visit people, but they had to stay outside the building. And of course, the resident was inside, so they talked by phone and waved and whatever. But it's, it's odd, to say the least.
Yeah.
So we're working with the Department of Health on getting clearance to be able to start that soon. We're very anxious to get the families back, but we're following all the DOH guidelines very carefully, as you can imagine. Hopefully that'll get started, I would say, in the next couple of weeks, but we have to get clearance from DOH to be able to get it started.
Is
I
that
just wanted
city
to bring those together.
that would be state DOH, I assume?
No, state, oh yeah, New York State Department of Health, yeah.
Right.
Yeah. So anyway, so we don't have a date yet on that, but it will be soon.
All right, very good. Should throw a big party once people are allowed back in the building.
Well, I'm gonna have to be very, very careful with it. You know that.
Yeah. Now, how practical is it, as I think maybe it was Pauline who mentioned it earlier, the idea of maybe using Isabella as a vaccination site. Is that a real possibility?
I doubt it, and I say that because you haven't been to the facility. Nobody has since this thing started. But when you come in to the facility, the Larson Library, which is immediately to the right when you walk in, every employee has to go there every day and get tested, with the temperature thing and all that. And twice a week, you have to have the nasal swab, and that's very active. When we had clinics at Isabella where we had CVS come in and they vaccinated our residents and our staff, and they were there, I think, 4 different times and maybe back again soon, but it was very carefully monitored. And I haven't had a conversation, but I very much doubt until this, that they're going to be able to provide outsiders with that capability of coming in.
I didn't think it was very feasible either. Okay.
Yeah.
All right.
I mean,
Do you
the
have
space is
anything?
great. No, that's it.
That's it. And any chance you already wrote this up and plan to send it to me?
Yes, I will send it to you tonight.
Okay, very good. Okay, that's a fair enough deal. Are there any questions for Ms. Lehman? All right, very good. Tanya, could you give us a report about the good work you're dealing on the noise task force?
Yes, first of all, thank you, Steve, so much for allowing me an opportunity to just continue to update everyone about the work of the YEMwood Task Force on Noise. We met on February 22nd, and we met with city agencies who deal with enforcement of these quote unquote quality of life issues that deal with unreasonable noise. Thank you, Steve, for offering that change in wording. And so we dealt with the focus of this meeting. We talked about in our August 4th, 2020 public hearing about the problem, right? So this particular meeting with city agencies focused on solutions, like what can they do to address these issues in advance of summer 2021, which is fast approaching. And the community, of course, doesn't want to see these same problems continue, show up in summer this year, and they also want to make sure there's a plan in place. So we basically we went to each agency that represent some of the main problems that we are experiencing that we've experienced in our community, to ask relevant city agencies what the plan would be, and that was the conversation. It was a very hefty conversation. For example, we talked about fireworks, and we spoke with the FDNY about their fireworks task force and what that task force does and to address it. And the task force itself is mainly just focusing on illegal fireworks sales. So they do a lot of out-of-state work, not necessarily enforcement on the ground. That would end up being with NYPD. And so we spoke with NYPD about what they can do to address it, and to start thinking of ideas to address it. One of the things the FDNY said that they need more funding. They would like to do more educational programs on fireworks danger, to talk about illegally using fireworks in our community, but they lack funding to do that. And so the mayor's office was there as well, and we of course asked the mayor's office to consider providing more funding for the FDNY to do that sort of work, because that's how they wanted to use any increased funding. And we wanted the task force to do more engagement with the community in terms of what it's doing, because it was really not transparent in terms of like what the work was, what they were doing, what the focus is. We're encouraging them to continue to engage with the task force and the greater community on ongoing efforts to combat illegal fireworks sales. We also spoke with NYPD and DEP, Department of Environmental Protection, about dirt bikes, altered vehicles, things like that. And as you know, sometimes it sounds like the Indy 500. I call it the Indy 500, as these bikes zip around in our community. And we spoke with the NYPD and DEP about doing joint efforts operations, and they agreed to do that, and they are apparently working on problem areas and looking at where they would operate or conduct these operations in the community. And our task force did offer several suggested areas that have been very problematic. And looking at also, of course, speed and noise cameras in problem areas, and seeing if there was a way for us to do even a pilot program or something would be helpful. And one of the things that we've discovered, for example, that this is not necessarily with dirt bikes and how, and this type of activity, and how it is really linked to it's not just a quality of life. It's just that some people, including some on our board, got to minimize this. It's always quality of life, people complaining. But one of the things that we know is that a lot of the people that engage in some of these activities, some of them are also engaged in criminal behavior. And I received information from the 33rd that they were seeking the identities of 3 individuals, one in the connection to shots fired incident within the precinct, the 33rd, that this happened recently, and that a man was approached by unknown male individuals operating motorbikes. And the victim and these people got into a verbal dispute, which escalated into a physical confrontation, which led to one of the individuals to break one of the car windows and brandish a firearm and discharge a round. So these are the sort of things that we are dealing with and we're talking about in our community, that these so-called quality of life issues definitely are lead to increased public safety threats in our community. And so it's important that we address this. But we're also asking people to find out, where the locations of these bikes, like where are they being stored? And there are some facilities apparently where they're stored, and there's some discussions in terms of how to get warrants to confiscate these vehicles and things like that. So these are the kind of conversations going on. And in the Parks Department, of course, last year we created a survey that identified problem parks in our areas where activity that is prohibited in our parks have been taking place, including, alcohol, loud parties with speakers that you need a permit for, and parties all night and things like that. And so we have been working with actually a head person at the Parks Department to talk about a plan to address those how to stave off those sort of things, because they don't have the funding to increase PEP officer presence, especially after hours. And that ends up being the baton thrown to the NYPD to do some enforcement after the PEP officers after hours. And so, we wanted to make sure that these problem areas are being addressed. These illegal activities in our parks are being addressed. And we also just want to have more clarity around enforcement, in terms of NYPD. Once the baton is turned over to them, what will be their response? We also looked at talk with Beta NYC. They were there and they gave a presentation about 311 noise complaints. And they found that there were a lot of complaints, of course, as we know, closed out with 5 minutes or less, and that particularly the 34th precinct had a major problem with that. They were considered an outlier because they had so many that were closed out so swiftly. And so one of the things that came up is, how do we integrate, data in terms of capturing, because one of the things that we discovered is that, yes, there's data that's captured by the NYPD in terms of 311 complaints. And then there are complaints that go to the DEP, and there are complaints that might go to DOT, depending on the situation. So how do we collate all of those different all that data into a comprehensive sort of data, so that we can get a more clear picture in terms of what type of complaints we're getting, how are they being responded to, that sort of thing. But we're trying to get people to focus on solutions and make sure that that there is a plan in place before summer 2020, because last year, some of you recall, these problems started back in May, middle of May, with the fireworks and with other things. And so it was very important to bring everybody together and figure out how can they work together and how can they come up with a plan to address some of these things. So, you know, we are going to stay on top of it, and we're going to be meeting with more stakeholders this month, including elected officials, to continue to address this and figure out what we can do and come up with a plan to address these problem issues. Are there any questions?
I just want to say, I think the major achievement from that meeting was the agreement that you brokered between NYPD and DEP to do the special operations on the loud motorbikes. I don't think I quite realized that it was zeroing in on those bikes, but I thought maybe it also involved some of the speeding cars. Is it just is it focused on?
No,
the
it's
bikes?
both. It's both. No, it's both. That operation would look at altered vehicles that have mufflers. You know, they alter their mufflers, and it sounds like shotgun. You know, it sounds like gun blasts. You know, when they alter it. So they're going to be focused on all of that. Yeah. So
very good, very good. That was a good outcome. Are there any questions for Tanya?
There was OC, myself, and I don't know, Betty, do you have your hand up on the phone? No? Okay.
All right. Can I choose OC first?
Sure.
Of course.
Go for it.
Okay, Tanya, question to you. The first one is actually more like a comment. I think I know where at least some of them are stored. I can share that with you because I don't want that in the public.
Yes, exactly.
The other question to you is, are those meetings open to other community board members or the public? And if so, how do you publicize it?
Yeah, what we do with these meetings is the task force meets itself, but we have what we call community advisory committee meetings where the public can come and the task force members are there and they can ask questions. We update the community about what the task force is doing, and people can ask questions, and community members can pitch in to help if there's something they want to assist with in this effort. They offer suggestions and ideas, which has been very helpful. And we do have those meetings as well that anybody from the public is welcome. We put because we're but this is like a on the ground grassroots thing. We do put those meetings out and and all the public forums, things like that, so people can go and attend.
Is it Ebenezer is posting them? Like, is there anyone from the office that's posting, hey?
No, this is not. This is the thing. This task force is not. This was a community-led task force that when we had the August 4th public hearing, the community after that, I had suggested the task force, right? And that, but the community was pushing back and saying they really wanted a community-led task force. They did not want a task force that was led by the community board or by elected official or CBO.
Okay.
And so, yeah, and and we're, and then obviously, our record on some of that, and that was where some of those concerns came up. But there are people on the board on the task force. We have, you may not know because you may not, but we have Mary Anderson is on there. She represents, she's one of the people we have representing the elderly and disabled, and we also have someone who represents the senior center at the Dykeman houses who are on there. We have businesses, small businesses, a number of them on there. We have people representing the schools, young people, youth, other activists who are on there. So we wanted to make sure it was very representative. It's like 21 people. Plus we have Columbia University's Mailman School of Public Health. They're also on our task force, as well as Cloth. Yvonne Tennant of Cloth is an advisor, as well as Dr. Arlene Bronzap, who's the environmental psychologist, famed environmental psychologist, is also an advisor. So, Steve has participated in a lot of those meetings as help,
But I'm not a member.
He's not a member.
It's not.
We
love you, Steve.
Steve is a community member.
It's
You
not
don't want
like
to be
the,
part of any club that would have you as a member. Right?
No, well,
it's not,
Steve is like a member. Steve is like a member. He's there.
it's not like the hair club for men. Daryl, did you have a question?
I did, yeah. It was about the elected officials. Obviously, this is a grassroots thing, but I just want to make sure, because I know from past meetings, was a high level of attendance, but low level of responsiveness. And I will say that the borough president's office in the early days seemed to be the only one that cared about this issue and was willing to do something about this issue. So I was just wondering how, are others stepping up as well?
There's been
and if you don't want to call out names, I
don't want to, but we don't know.
I want you to.
I know, right? I'm going to say, we will be able.
Maybe you want to hold on until you have your next meeting.
Right. We don't know what the response will be, but we're going to go in the same way we went in with the city agencies. The discussion is only about what are you going to do? Like what is the plan, right? So, so we're targeting having a plan, coming out with some concrete things that can be done to address this issue and that they can do, because there are things that uniquely elected officials obviously can do that can help the city agencies in their efforts tremendously. So they need to work in tandem as well. So we don't know. We're hopeful. Like I said, I mean, we've been very clear that this problem cannot be repeated. We cannot have people being burned out of their homes. We cannot have people dying from fireworks, burned out. We cannot have, people suffering and, over this like they did last summer. And as I said, it is not just quality of life. As you can see, it is, these things lead to other activities in our community, including shootings and things like that we saw.
All right. What, any other questions or comments? All right. Very good.
Thank you. I hope I was clear, and I appreciate everybody's support. We're doing the best we can, and hopefully we'll, make some things happen.
You'll keep us in the loop, I hope.
Yes, definitely. Obviously. Thank you.
Okay, old business. The corner project has, in fact, found a new location and moved into it at 500 West 180th Street on the corner of Amsterdam Avenue. The former site of the methadone maintenance program, now known as, it's now known as either Upstart or Startup. Maybe it's called Startup. And then they moved out and they moved down the block, and now Corner Project has moved into that old space, and they opened up on Tuesday, and they're now functioning once again with their own space, and so they no longer have to have the trailers out on the street. I've invited them to come before the committee, so I think we'll probably have them come next month. Are the members okay with that idea?
Yeah.
Okay.
Yes.
Okay. I heard 2 coughs in favor and
yes,
and no coughs opposed. Very good.
We do have a question, Steve. Jay's hand is up.
Okay.
Mr. Mazer.
Actually, I had additional old business.
Okay, go ahead.
Well, last spring, we discussed the problem of nursing home deaths, and I had some further information that's developed in the past couple of weeks. The legislation which created exemptions from lawsuits for hospitals and nursing homes was put in the budget by the governor's office at the last minute, had been written by the Greater New York Hospital Association, concomitant with which the Greater New York Hospital Association also contributed $1 million to the then broke state Democratic Committee. And this affected in many ways what transpired later on, although I don't in any way, and I think directly, although I think it's also worth noting that at the time nursing home residents were being brought back to nursing homes, there was absolutely no shortage of hospital beds. Hospital beds were set up at the Javits Center. There was a ship sent by the federal government. And there was also an emergency hospital set up in Central Park by a homophobic Christian group, all of which had a huge number of vacant beds where people could have been sent to. And there has been some speculation that the reasons hospitals were anxious to get nursing home patients out of the hospital is because these beds could be used for more profitable things than treating COVID-19, such as hip and knee replacements.
Yeah, but they weren't doing that either.
That's true. I said it was speculation. I didn't know that to be a fact.
Yeah, no, that doesn't pan out.
Yeah, on the other hand, the rest of what I said does.
Yeah, but because they basically stopped most of their normal operations and elective surgeries as well. Well, I mean, the truth of this matter still has yet to really come out. And I noticed today when I checked the state health department website, because I checked to see the current figures on nursing home deaths, and usually there's a new report, I think every week or so. And there's been no updated report in the last month. So I don't know what that signifies.
That's interesting.
And I tell you, I have to take a closer look at the report issued by the state attorney general. And I'm sorry I have not really read it, but what I saw didn't really clarify for me the connection between people being sent back to the nursing homes and then the issue about the fact that people who were dying, who had been sent in the other direction from the nursing homes to the hospitals, the fact that those deaths were not being counted against the nursing homes. I mean, the whole issue right now is about the fact that those people, the ones sent from the nursing homes to the hospitals and not the other way around, that those people were not, their deaths were not being properly attributed to the nursing homes. So I don't quite understand how these two things equate. But we should take a closer look. The two of us should take a closer look. All the members of the committee should take a closer look at that Attorney General's report that came out within the last month, which then led to the State Health Department updating the public reporting on nursing home deaths outside of the nursing homes at the hospitals themselves. Jay, did you have anything more?
Yeah, I believe that the deaths were also not reported at rehab facilities.
They updated those numbers.
Yeah, that's right. Those were updated.
Yeah, the figures that were reported were for both the nursing homes and and I believe the long-term care facilities. I don't know. I may be wrong. I believe that's what it was. Betty, would you know? Betty, are you still with us?
Okay, can you hear me now?
Yeah.
Okay. Yeah, I actually haven't looked at that report in over a week, so I don't know the statistics. I believe there were, but I do know I did read the Attorney General's report. It's about 76 pages.
Yeah.
And it's general. It's not specific. It does make some recommendations. And as you know, there are 6 bills pending in the state now with the Senate on a variety of different reforms that they want to make in the nursing home industry overall, about reporting, about infection control, about information on contractors and staffing, et cetera. So there'll be a lot of change coming within the industry, I'm going to say, in the next year or so, not only in New York, but frankly, nationwide, because as you all know, it has been a nationwide problem. What Governor Cuomo did in New York is specific to the fact the total number of deaths is the same.
Yeah.
But what he did was reported it deaths that took place in the nursing home. I mean, in the hospital, even though they came from the nursing home, he counted those as hospital deaths.
But
So
as Jay just mentioned earlier, the statistics that were recently updated, I think were not just from nursing homes, but also from the rehab centers. Is that correct?
It says
Rehab is
adult
supposed-
care facility. On the database, it says adult care facility.
Adult care facilities could be assisted living facilities.
Right. Yeah, that's something
And
else. Yeah.
Most of them are.
That's different.
And
Yeah.
they're not grouped together, they're broken out separately.
Yes,
Okay.
that's right. Good. All right, very good. Also under old business, I sent around the latest report from DDC on the remaining project in our district where gas work and water main work is being done, mostly in the 170s, 180s, east of Broadway. It's now 51.25% completed, and they expect the project to be completed in June. And the latest statistics on acceptably clean streets for the month of January, our district was at 95.7%. The previous month we had been at 90.4%. That would be in December. Sidewalks were acceptably clean, 97.9%. Previous month in December, we were slightly lower at 96.3. I did not receive the monthly report from DEP on the most common service request from Committee Board 12. When I receive it, I will send it around to the committee members. Under new business, as you know, as you probably know,
We have old business too.
We have more old business?
Yes.
Okay, what's your, what, it better be really old business.
It is old business. It's the e-waste recycling. It came up last meeting that we were going to try.
I'm ruling you out of order. I'm bringing it up under new business.
Okay, sorry.
Okay, is there any other old business, really old business? Okay, no old business. Okay, under new business, Ms. Fisher, you have an item of new business?
Yes. Well, part of it is old, which is we have been set for doing an e-waste recycling in Wood Hill Park. And it was brought up last month that we also need to do one in Washington Heights. The last one in Washington Heights was in July 2017.
Well, before you leave Inwood, is it a fact that the Inwood e-waste recycling collection is taking place this Saturday from 10 a.m. to 4 p.m. at Seaman Avenue and Isham Street? Is that true?
It is a fact. And in fact, if you bring your e-waste recycling, Princeton Wood Hill Park will treat you to a hot chocolate from Beauty Coffee. We'll have hot chocolate there.
Now, what about this old Zenith table radio that I have that no longer works? Is that something that would be accepted at the e-waste site, or should I just throw it out with the normal trash?
I don't think you're allowed to throw it out because it's a electronic device.
Does the Smithsonian pick up? I don't know.
Yeah, no, it's not that old. It's not quite that old. Although I think I do have something that maybe would be acceptable to the Smithsonian. You may have a point there. But so should I be bringing my radio up to Seaman and Isham?
Well, it says TVs, phones, audiovisual, mouse, cables. I don't see radios on here.
I didn't see radios either. All right.
I
So
will check. No.
We'll have to look into that. Okay. Now, what you were trying to tell us on the new business was that we also wanted to have an e-waste site in Washington Heights, which I think OC was also promoting. And we need to come up with a possible location because the Lower East Side Ecology Center is open to the idea. And I had proposed to the schoolyard at PS 48, and I think you said that there's not much pedestrian traffic there, and you didn't think that would work. And maybe you're right. So your alternative was to do it at the medical center at 168th and Haven.
Well, the reason I suggested that is I know they wanted to sort of bring that area to life, and I thought that it could be part of a bigger sort of upcycling, recycling event. But yes,
Okay,
I thought that would be a well-traveled area.
Okay, well, my fear is that one is also
deserted.
off the beaten track, especially for weekends. I don't see too many people there either. So maybe we should try the outside the United Palace at Broadway and 175th.
Well, that's where they did it the first year. I mean, in 2017, they had it on Broadway between West 175th and West 176. So that's the Inwood, the United Palace block. It was in the middle of the summer, though. It was held on July 15th. So that could have been, I don't know if it was location, I don't know if it was timing, and I don't know if it was lack of marketing or all three sort of combined. I don't know how bad a site it was. I mean, Christine will be up here on Saturday and we'll be out there most of the day. So I can ask her how to come up with an ideal location and why she thinks that one failed.
Do you know what time she'll be there?
She usually comes up. She's usually there for the whole day between 10 and 4.
Okay, I'm gonna try to come up there too, because I gotta, especially if they take my radio.
Okay, I'm going to add something to that discussion.
Yeah, please.
I think that it's wrong to try something once and when it doesn't work, they just disappear and not trying another location in Washington Heights. That's fundamentally wrong. If you want residents to start understanding that there is such thing as recycling and it's close by, you really have to stick to one location, and in addition to what we have in Inwood. Or try a different location within Washington Heights, but I really think like Amsterdam, Audubon, those streets should be, because Amsterdam is a large street, and I really think that they should stick to it for at least 2 years before they can say that it's not a successful location.
Well, I think we need to do something centrally located, and especially along Broadway, so that both sides of the community can participate.
I'm fine with your suggestion, Steve, about the school in Broadway. I'm sorry, I forgot which one is it. So I'm fine with that.
I was thinking about PS 48 at 185th Street in Broadway, maybe.
Okay.
Well, and near that, Steve, I was thinking, what is that next to the subway where there's that big empty lot at the 184 entrance of 181st on the Overlook Terrace.
Overlook Terrace. Yeah. Oh, yeah. Where the guy tried to put up that tall building. Yeah, but
right. It's a big empty space, and I think there's enough space there.
What
at the turn.
Staples on 180 or 2nd or 3rd?
What? I'm sorry. What is that?
Staples.
It was.
They have parking.
Well, the schoolyard I'm thinking of is I think directly north of Staples.
Okay.
And can I ask too, like maybe don't forget Lower Washington Heights, because people tend to forget Lower, like, so, like below 180, like something there. There is an empty lot. There's a lot at 163 where the C train is.
Well, we
that
can-
unused
The other
monstrosity.
place, Steve, what about PS 128?
Well, actually, well, maybe Mitchell Square Park. There's a
Yeah.
big
Oh,
open space.
yes. There
There's
you
a big-
go.
There's a big open space there in
Yeah.
Mitchell Square.
Well, that's 157,
No, at 167.
167. Okay.
That would be good.
That just north of the Audubon Ballroom
Yeah.
building.
Because I'm with Tanya on going further south because I have a feeling that people that would dump off at Staples are gonna be in cars and they just as soon drive up to Inwood or down.
I'm thinking Mitchell Square might be a good.
Yeah.
Might be good.
That's a great suggestion. Wow. Yeah.
All right, let's talk to oh gosh.
Christine.
Thank you. Let's talk to Christine on Saturday. Very good.
But
Okay,
please make sure that she is aware, this must be like at least 2 years commitment before she deemed that as a failed, initiative.
Well, we also need to push on timing for it to be earlier in the summer.
Oh, yeah, okay, we'll get her to sign on the dotted line. Okay, any other new business?
Yes, two things. One is the big river sweep happens in Inwood Hill Park the first Saturday in May, and second is Earth Day is on the 22nd of April, and we will be having our Earth Day Festival on the 24th. So that's both environmental events.
Are you sure you're gonna be able to do the festival?
Socially distanced. We'll be doing something to mark the day.
And you plan to do it on, did you say the 24th?
The 24th
And did you say that the Big River Sweep is the
is
first
on May 1st. Yes.
May Day, May 1st.
Yes. It's always the first Saturday in May unless they do what they did last year, which is change it to October, in which case in a fiscal year, we had two of them.
Okay, but the first Saturday in May is
Yes.
not always May the 1st. And does this take place in Inwood Hill Park?
Yes, it does. Both of them do.
It doesn't take place at the end of Dykeman Street?
We will be doing two sites this year. One will be at the end of Dykeman and one will be at the northern part of the park.
Two sites, okay, very good. All right, any other new business? And I think we just covered announcements as well. Do I see a willingness to adjourn? You can indicate by coughing.
Tanya, I sent you an email.
Okay.
Okay, thank you, OC. Thank you.
Okay, I
I
heard
second your motion.
No, I'm sorry. You have to cough.
I did.
Oh, you
I did. I
Okay.
just didn't know if you recognized.
I heard a second cough, so the motion has been seconded. Okay, we're going to adjourn now at 9:45 p.m. Thank you all.
Thank you.
Thank you, everybody.
Bye.
Good night. Nice seeing you. Thank you. Bye-bye.
Bye.
Good night.